Have ADHD? Alta Sciences is looking for adults aged 18 to 55 with ADHD to take part in a research study with an investigational medication. Overall stage of our facility at Overland Park.
Love that lag.
Participants may receive compensation up to $5,325 to take a trial. For more information and to see the job, call 913-696-1660. 913-696-1660 or visit us at altasciences.com/participant.
One main reason for strong morning hunger. Always wake up hungry? Ever wonder why? Always concerned that I would call for help, particularly concerned when that help is before I engage in the same together. Whenever I manage to do this call,
Okay.
he's got a day of small devil, could be in serious trouble. Australian reptile genetics Hi mate, hey Tim, welcome. Yeah, cheers to see you. I've got Kira down here from Chittagong. I've just arrived at Kevlar and I met straight away with Daddy. And no one came around, we're going to get down and see these guys. Is the largest conservation breeding program of devils in Australia. With devil's natural tumour wiping out the population, Tim is hoping insurance colonies like this one will stop the species becoming extinct. So what actually happened? So we're It's just wild, mate. We are quite literally as far in the opposite direction of breeding season as we can be. She's breeding Joey's. We've got a Joey 5 months and breeding season, which is unbelievable. So don't hear it at this time of year. Tim and Dean are justifiably worried. A lone Joey born out of the regular breeding season is at serious risk. The Joey are in the devils that are about to start. Testosterone. If I leave them in the yard and the Joey bleeds, he'll be killed. Is attempting to take blood from one of 3 sick stroke kids. Lisa is worried the tiny 6-week-old may be suffering.
So he's had not much to eat or drink. He's got some vomiting and diarrhea. He's only tiny and he can go downhill.
In reception, foster parents Steve and Linda are anxiously waiting for news. They're just doing their best, trying to sort of, fingers crossed it's all okay.
Let's try number 2. This one is a little bit more regular. It's proving quite difficult. And also happy camper.
Yeah, bro, I'm gonna go. I'm gonna take that.
I'm not even going to test the third kin because she's the one that actually has the most energy out of the lot, so I'm going to save her the pricks. Next step is we're going to pop the 2 little silly boys onto a drip, get some fluids into them. Hopefully they'll start feeling a lot better and get some food into them as soon as possible.
While the 2 boys have to stay at Sash, there is some good news for their sister. With the actual girl kid, she's actually coming home with us. She's strong enough to come home. That is a bit of good news. Okay, let's get her some sleep.
attempt to pop them on fluids, they've got tiny little legs and tiny little veins. That was absolutely really bad. That catheter went surprisingly well. I'm quite amazed how easily we got that vein.
Go back to bed. Let's just hope your brother's as good.
So what did he weigh? 330. Oh, you're the little one. Yeah, the tiniest one, but the hardest one to handle.
The naughtiest.
Pocket rocket.
I can't even see where the system collapsed. So pitiful.
With such tiny veins, the question is, will Lisa be able to insert the much-needed fluids into the sixth stray?
But if we don't get this in, we're not going to be able to give this kid an IV fluid. Right now he's fighting his it's not making our job much easier. Dear me.
It's a sign. Doesn't know your dad's time. It's a sign.
At the Bondi Clinic, Chris is examining Benji.
It's okay.
The 12-month-old Australian Silky Terrier has a heart murmur, and Chris is trying to confirm just how severe the problem is.
So what I'm doing there is I'm actually pressing on his gums. By doing that, what I do is I force all the blood out of the gums, and then wait for his own circulation, so his own blood pressure to push it back in. For a normal dog, it takes between about 1 and 2 seconds. With Benji, I'm going to press 1, 2, it's about 3. So slow. It's quite slow. What that's really telling me is that his circulation isn't really doing its job. It's not forcing the blood around the body to those places where it's needed, and that worries me. Are you seeing any other signs? I mean, is there anything day to day that you notice that you think isn't quite right?
Yeah, he gets overtired very easily, especially on hot days. He starts to almost wheeze, like he's not getting enough oxygen in his lungs. He usually cries, like he gets tears in his eyes. I've never known a dog to cry or anything like that. I just can tell now that he's in pain. It's almost like he had a heart attack a couple of times after he couldn't breathe and his heart was just like that. And I just sort of beat him on the top here and his blood started going. Obviously, he started breathing normally.
When Mel tells me that Benji has trouble breathing, he wheezes, he looks like he's going to collapse. They're all things that really worry me about this little dog. At 1 year of age, he should be running around madly, having the absolute time of his life. But he's not doing that. And that's a big concern. So listen to his heart.
It's okay. Let Dr. Chris look after you.
I'll be honest, I'm almost nervous picking up my stethoscope to listen to Benji's chest. You can feel just how much Mel's invested emotionally in this little guy. A bit of bad news here, it could really crush him. Just be a little bit careful, she's a bit feisty, is she? Yeah, she's protecting her den.
At Devil Ark, Tim and manager Dean need to remove aggressive Kira from her den.
She's a firecracker, man. She's pretty protective.
The Devil has given birth to a Joey 5 months out of breeding season, and Tim needs to make sure both mum and baby are healthy.
That's going to be tricky, mate, but we need to catch Mum first. Yep. Separate her from the Joey, and then assess them both. Yep. One of the greatest risks here is that Mum's cranky. She's defensive. Now, she's got teeth showing, and she's going to bite. If the Joey gets into the wrong spot because we do something, we catch Mum, and she turns around to bite, she could bite the Joey. Don't want that to happen. Okay, so just watch your fingers, mate, because she's going to have a chomp. It's all right, darling. You're all right. You can't see the Joey. No, I can't see the Joey. It's not in the room. Let's get this foot off. That's it. Okay, that's good, mate. I can see it, mate. Just under there. Sit down. If you just wave grab the boot. Yep. As soon as she looks at you, I'm going to grab that tail, lift her up. If the joey comes off, that's fine. If it stays on, perfect. I'll lift her up, and then we'll move. She looking at you? Yep, looking at me. There we go. Okay. Now just watch out that she doesn't turn around, mate. Yep, keep him there for a sec. That's good. Okay. There we go. Hey, hello, mate. You're all right. You got a little boy, mate. He's gorgeous, isn't he? This little devil needs a name. And what better name for a devil born under these circumstances than Lucky? He's already feisty and all, isn't he? Yeah.
With Lucky now safely with Dean, Tim can make sure that Kira is healthy.
She looks good. Mum's physically perfect. She's in good condition. There are no scars, no battle wounds. Everything looks good. Now it's time to have a look inside the pouch. And I can see quickly that there's only one active teat. Now the other three, they're tiny, they're inactive, they're very small. It means she doesn't have any more joeys. Let's get Mum away, and then we'll have a look at him, hey? But I think we get her in that box nice and quiet now. That's the important thing. Mum's in the box, and now I've got to have a look at the joey. And I just want it to be healthy. It's a very odd circumstance, but this whole program is about breeding and these joeys. I hope he's okay.
Representative Sharice Davids is standing up to big drug companies. She's fighting to give Medicare the power to negotiate with drug companies for lower prices, reducing your costs by as much as 55%. Thank her for leading the fight to lower your drug prices.
At the Bondi Clinic, Chris is checking out a tiny rescue dog with a heart murmur. He's becoming increasingly worried the condition is far worse than owner Mel suspects.
Normal heart murmurs, they're very subtle. This one, it's screaming in my ears.
I'm looking at Chris, and it's kind of scared me that he was taking so long. To me, that indicates that it might not be a normal heart murmur, that it could be something more severe.
I can almost feel it rather than hear it. It's such a powerful murmur. It's really strong. And it's not good news.
It's a really big murmur there.
So his heart, when it's beating, instead of it being really crisp and boom, it's a big, loud whoosh, 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 whoosh. So his heart's not able to pump the blood that his body needs because it's leaking all through it. I'm actually quite concerned about Benji. It's not like a heart condition that might pose a problem in a few years' time. This is an issue that could kill Benji any day. He's either got some sort of obstruction in his heart that's not allowing the blood to pump out properly, or he's got a hole in there, or some sort of leaky valve that's meaning that the heart is no longer an efficient pump. It's got leaks everywhere.
So, pretty bad then?
Yeah. I don't like what I'm hearing. And the best thing is that we organise for you to go up to Saturday. And from there we can get a good look at that heart, understand what we're facing here.
Look, if it's a money thing, I'll do whatever it takes. I'll beg and borrow or whatever. I'll do it. I haven't got that much money, but whatever I've got, we can help you. He's the best thing that's ever happened to me, and I don't want to let him go.
Just a brief mention that the day for recycling came and you didn't have these put into the recycling nor carry it out to the big recycling bin.
Okay.
So when I bring the recycling bin back in, you need to take those down, put them in the thing, and then dump them into
not really the news that I wanted to hear. Thinking about the pain that Benji's going through, a bit distressed and a little bit scared about what's going to happen moving forward.
We're together in this now, right?
Thank you. Thank you, Doctor.
I don't feel like you're gonna fight this by yourself.
Thank you.
At SASH, Lisa is attempting to insert a catheter into a tiny, dehydrated and malnourished kitten. But it's making the little 6-week-old too distressed.
Dear me. This one's had no vomiting or diarrhea. He's eating on and off. He's just a little flat, so hopefully we can syringe feed him and that will be enough. So I don't think it's worth struggling with him to get that tiny little bang. We'll keep an eye on this little kitten, and I'm glad he's here, and we can watch him really closely. If he goes downhill at all, we can treat him straight away. I'm thinking about eating. You can drink on your own, baby. You can drink on your own? It's not 100% sure. It probably tastes a bit strange. What's the mom? Not really suckling. I'll just drink in the end. I'm supposed to bite it.
It's been a big day for the little strays. The staff at SASH will monitor the tiny brothers overnight to make sure their condition doesn't deteriorate.
The sick little kitten is on a drip, which is the most important thing. He had vomiting and diarrhea, and we're replenishing his fluids. His brother didn't want a catheter, but fortunately he's not the one that had gastro, so he's going to get away with just being syringe fed, and hopefully he's not going to go downhill over it. Alright, let's take you in bed. Okay. Look, your brother's in there fast asleep now. Don't disturb him. And cuddle up and have a good little sleep as well. Alright, he's on a drip and he's getting better. You follow his lead. Alright, kitty? There you go. Good boy.
What are you doing being born at this time of year? What are you doing at this time of year? You got it all the wrong way round. You got character. Hey, like your mum. At Devil Ark in northwest New South Wales, Tim is about to examine Lucky. You're all right, dear. The tiny Tassie Devil Joey was born out of season, and Tim needs to make sure he's healthy.
Let's get some weights and just have a bit better look at him and make sure that he's healthy. Here you go. Let's settle right down now. Hello, mate. I think he's almost half a kilo on the dot. But physically, he's perfect. My main worry is that if we don't do something and we put him back in that yard with mum and other breeding devils, he might not stay that way. Now, I've really got a dilemma. I've got a healthy mum and Joey, and under normal circumstances, they'd be fine. But these aren't normal circumstances. They're in a yard that's been stocked with devils that are about to breed. If he leaves mum and enters that environment in the state that it's in, he'll be killed. So, Tim, what do you think we should do with Lucky? Well, that's what I'm thinking about now. We can leave mum and Lucky Boy in an intensive yard like this, and she can rear him and finish weaning. But that means mum is not going to breed this year. She's way out of sync. And we need Joey's. This is a conservation project. She must breed. I've made a decision. It wasn't an easy decision to make, but I'm going to intervene, and I'm going to hammer Lucky.
The Devil Joey will now return to the Australian Reptile Park with Tim for around-the-clock care.
Well, this is it, mate. There's no sentimental goodbyes for mum. It's natural. In 2 months she'll wean him anyway. Plan is that she breeds again in a month's time, and Lucky Boy's back here and doing his own thing in 6 months, eh? After you.
So Tim's going to hand me the baby, which I think is great. We're going to have a nice, healthy baby to come back for breeding in a couple of years, and Mum's going back in for breeding this year.
Mate, well, I'm not back to work. Well, good luck with the precious cargo. Yeah. Good luck with the real breeding season. See you next time. Yeah, good on you, mate. See ya.
Better look so tasty, y'all. I got all price
or a loved one have ADHD? Alta Sciences is looking for adults aged 18 to 55 with ADHD to take part in a research study with an investigational medication. Overnight stays at our facility in Overland Park are required, and qualified participants may receive compensation up to $5,325 for time and travel. For more information and to see if you qualify, call 913-696-1601. That's 913-696-1601. Or visit us at altasciences.com/participant.
Chris, how are you? Good, Mel. G'day, Mel. How are you? This is Benji. Heard about Benji? Hello, mate. This is a bit scary.
Hey, what's up? You got eyes under there, did I?
All right, come on in, we'll have a look.
Chris is so concerned about Benji's heart murmur, he's come along to Sash with owner Mel to see specialist surgeon Dr. Andrew Marchewski.
Good boy. There.
Benj, that's a big murmur. Listening to Benji's heart, you're not getting the normal dup sound. It's really a sound. So the blood's, it's what we call a murmur. And the blood stop flowing out. Out of 6, which is how we grade murmurs, it's 4 or 5. And generally when they're like that at this age, it means that we have to do something to fix it, or he'll have a short life. And that means, you've got a year, maybe, and it might not even be that long. I knew, there could be bad news, but nothing that severe. So I think the first thing we need to do is heart ultrasound, so that we can find out exactly where all this problem starts and go from there. There are a number of things that could be going wrong with Benji's heart. You could have a hole in his heart. You could have a valve that's leaking. You could have a valve that's too narrow. None of them are good things. Some of them we can fix, some of them we can't. But we need to find out a bit more than we can tell.
So here we've got Benji's heart on the screen.
Specialist cardiologist Dr. Rita Singh is conducting the ultrasound.
My first impression is that we do have some moderate enlargement of the right atrium and some moderate thickening to the wall of the right ventricle. Well, everything we're seeing now is all consistent with pulmonic stenosis.
Pulmonic stenosis is a rare and extremely dangerous condition, which, if left untreated, can lead to sudden death.
So, Rita, does he look like one of those dogs where something can be done surgically?
I think he looks like he'd be a really good candidate for the correctional procedure.
I guess all of this means that I've got to go and tell Mel that his dog needs surgery. It's not something we can ignore. It's not something we can give medicines to. This little dog's going to have surgery, and otherwise he'll die. It's not like open heart surgery. We can do a surgery where we put a catheter into a vein down in his leg, thread it all the way up into his heart, and then use a balloon, pass across that valve that's narrowed, the balloon's deflated, and then we've got it across there, we blow it up, and it essentially tears open that narrowed area and allows blood to flow.
Given the information overload that Mel's had to experience today, I'd love to be able to say to him, you know what, mate, take some time out and think about it. But the situation with this heart condition is that it's not possible. With every day that goes by, Benji is damaging his heart more and more. He has to go into surgery, and he has to go in right now.
At Sash, life-saving surgery to repair Benji's heart is about to get underway. The little pup is suffering pulmonic stenosis, a condition which could kill him.
As usual, you're in charge, and I'll just do what you tell me to do. So.
Okay, let's do this.
Cardiologist Dr. Rita Singh will be performing the delicate procedure, working closely with specialist surgeon Dr. Andrew Marchewski.
First thing I've got to do is pass a wire into his heart via his jugular vein.
I can see it. It's right there. Have you got it?
No, not yet. We're having a few issues here. Just he's so small, he's got such a small vein that we're trying to thread this really quite big needle down. But, We'll get there.
Oh. Sounds like it's going. Thank you, Andrew.
We just have a picture. There we go.
The guide wire is now in place. The next stage of the procedure will be even more delicate.
We've actually got to get a catheter into his heart, and this one's got a little balloon on the end of it.
The balloon will be used to force an opening in Benji's constricted heart valve.
That's it.
Really fiddly this part. Really hard.
Come on. There you go.
With the catheter now fully inserted,
Wait. Hang on a second. Stop for a second.
the surgery is at a critical stage.
The balloon now is sitting just over that narrow valve. It gets a little more risky when we actually start trying to blow it up.
Alright, shall we just go? Alright, go.
Ready?
Yeah.
Here we go. Here we go. There we go.
Okay.
Just perfect.
He's not happy.
At this point, Benji's life is hanging in the balance. The balloon has done its job, making an opening in the valve, but the blood can't start flowing until the balloon is out.
The dog's not doing well. We need to move on, Andrew. That's what they want. Which part do you want to do? Just, yeah, just go see
The team has just seconds to get the balloon out so Benji's heart can recover.
Alright, fly out. I'm pulling it back too. Alright, leave it. We'll keep going, you keep going. It's out and pulling out too. Okay.
Alright, we're done here.
The delicate surgery is over. Benji is out of danger.
Basically, Benji's outcome could not have been any better. We just put a balloon across his valve, opened it up, and now his heart's basically pumping like a normal. It really can't be any better than that.
I'm down off the mountain, and the mountain weather's certainly gone. Little Lucky's safely stashed in the pouch. I hope he likes his new home at the reptile park.
Tim is now on his way to the Australian Reptile Park with Lucky. The little Tasmanian devil was born outside the regular breeding season at Devilark and now needs to be hand-raised.
I'm back at the reptile park, and Lucky's had a rest and hasn't had a feed for 5 hours now, so I'm going to try and feed him straight away. Hey, buddy. Devils are really messy feeders, so I'm going to take him out of his beanie, which is his new pouch, and put him into a little towel. Tuck the arms down, and I'm going to wrap it around him. See? Good boy. Now it's time for your milk, buddy. This can be a stressful experience for Lucky. If he goes a day or so without feeding well, he's going to become dehydrated. It could go downhill really quickly. He's healthy right now. I want to keep him like that. This is an artificial milk, and this is what Lucky's going to drink for the next while. Now, there's not much in there, and I expect him only to take a little bit of that. It's nice and warm, but I just want him to get a taste for it. It's going to be a little bit different to Mum's, but if he took the littlest bit, I'd be a happy man. Will you take this? Here you go. Good boy. This is the first feed, and he's chewing away, sucking away. That's just great. You're doing really good, mate. A little bit more. That's a boy.
It's a positive step for little Lucky. But Joey will remain at the reptile park for the next 6 months. Hopefully then he will return to Devilark to live permanently.
That was great. I couldn't be happier. Lucky was calm. He didn't drink a lot of milk, but he did drink. Things are looking good for Lucky.
Hey, buddy. You're still pretty flat. Why are you not eating well?
It's been 24 hours since 2 stray sick kittens were admitted to SASH.
Your brother's on a drip and you're going to have to go on one too, sweetie.
The 6-week-old brothers were close to death, suffering dehydration and malnutrition.
Really worried about the smallest kitten. He's still really flat. We gave him overnight to see if he would start eating on his own or take the syringe feeding, and he doesn't want a bar of it. He's getting progressively more lethargic. So I'm going to put him on fluids, and he's going to feel a whole lot better once they get into him.
With the life-saving fluid slowly being administered, Lisa now turns her attention to helping the little kittens consume some much-needed food.
Yummy. Nice. That's a good boy. You're going to feel so much better, but we can't send you home till you eat by yourself. Look, these kittens are homeless, so they need a lot of love. They need a lot more nutrition and care than they've been getting. Linda and Steve have done a wonderful job bringing them in and looking after them. Without them, they'd be on the street and they wouldn't have stood a chance. So clear as can be.
Hey, Binge. You coming out? You coming out?
At Sash, it's been just 24 hours since the intricate surgery to fix little Benji's heart murmur.
You're looking far too relaxed, isn't you? I mean, and the great thing about what we've done is we've done an amazing thing for his heart, but done it totally non-invasively. So he's got a little nick in his vein there, and yet he's right to go home.
For owner Mel, it's been an emotional ordeal, and he's anxious to be reunited with his brave little mate.
I'm really excited to see what they say is true. You know, a dog's a man's best friend, and he really is. He really is my best little buddy, and can't wait to see him.
Who's that? I know. Good boy.
Oh, it's me. I'm sorry. I left you a couple of days, didn't I, buddy? I feel like a big load or a pressure has been lifted off my shoulders, and just to have everything back, I feel so happy. It's just so happy. Benji, yeah, Benji. Hey, buddy. When I first met Benji, he was a quiet, just reserved little dog, and he just didn't look happy. But you see him now, and he's bouncing around and just being a crazy puppy. So I think we've made a big difference to him. Hey, buddy, you're going to go home now. Going home. Benji, go home. Yeah. He's a good boy.
It's been 2 days since these tiny brothers arrived at Sash, fighting for their lives.
Sorry to wake you, buddy, but I've got good news.
But before Lisa gives the all clear for these kittens to return to foster carers Steve and Linda,
It's dinner time.
she has one final test for the two strays.
Yeah, it is. It's dinner time. And show me how you eat. Come on. Hey, look at you. You're a little piggy. Hey, is that yummy? When this little kitten came in, I was worried that there was a chance he wouldn't even make it, and now he's eating by himself, and that is a huge improvement.
His feisty little brother is also showing he has a healthy appetite.
I'm so proud of you, little one. Look at your messy face. Is that yummy?
In reception, Steve and Linda are eager to take the little brothers home.
It'd be great to see them jumping around and see their appetite up, and yeah, it'd be good to see. Fingers crossed, it's all good from here.
Look how good they look.
Thank you, hello. You're not standing up a little more with it. It's just excellent. Yeah, hello.
It's pretty amazing how caring some people are. These kittens were strays. They didn't stand a chance, and then Linda and Steve took them in. These kittens are going to warm the hearts of whoever takes them in. It's just like they've done to mine. Do you think you'll find these little guys home? Or are you going to...
Well, it's just fairly easy, I think, to except I want to make sure that if they go somewhere good. I think people like these. Should we go take one more? Yes, big sister. Should we wait for it?
There you go, mate. Go play.
As for brave little Benji, it's been 8 weeks since the operation to repair his heart.
No way. I'm saying it. I'm not sure I'm believing it. I expected a change with Benji, an improvement, hopefully, but I didn't expect this. I just saw more in 50 metres than I saw before at all.
Oh, Chris, it's amazing. The difference in him is amazing. You would have never have done that sprint ever before.
That run there, it's better than any stethoscope, any ultrasound, because that shows you that not only is he healthy, he's happy as well.
I can't describe to you in words how happy I feel just seeing him being himself, or being this Benji that I never knew was there before. To see him happy, I feel good inside myself. You know, it's been a journey, and the outcome it's been special. This has gone beyond my wildest expectations. Yeah, I could spend the next 10 years hanging out with him and chilling out and doing all the things that we do. Yeah, and it's great. It's really great. Thank you. Thank you so much.
No worries, mate. Thank you, Neil.
Hi, I'm Dr. Danny Dusek from Bondi Vets. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you in our next video.
You make my world a better place.
Yes.
She's walking with me. Hello, guys.
Hello.
You're here to see Chris this morning?
Yes, we'd like to have a look at our cats.
Okay, a little kitty cat. Can I have a little look?
Yes, certainly.
No way.
Just a little unusual.
This is definitely a first for the Bondi Clinic.
It's just... That's a baby bug, right? Baby bug, right?
Donna and Amanda from the animal rescue group Lottle have brought in a very unusual patient for Chris to examine.
We wanted Dr. Chris to give her her first health check. We thought she's a very special animal. We wanted her to see a very special vet. So, and we thought it'd be a lovely surprise for him as well.
Alright. So Zandy, right?
That's correct, yes.
We get a lot of cats through the door here. I mean, Persians, Himalayans, Burmese, Burmans. We get a lot. Not this kind of cat, though. You are just a little bit special. Yeah. This is about as good as it gets. I kind of thought we'd seen almost everything here at the Bondi Clinic. No, we've never had a lion before. It's just something else.
Come on, Bubba. Let's go.
At the Bondi Referral Hospital SASH, Alana is arriving with 7-month-old Callie.
We noticed that she had some little holes in the top of her mouth. There's a bit of blood around them. So I really have no clue what's going on or what she's done, but it looks like it might be something to worry about.
You fix your mouth. Yeah, make it all better.
Callie is definitely my little baby. She's spoiled beyond belief, so I want to make sure that there's nothing wrong with her.
So what's happening?
She likes to chew lots of things.
Yeah.
She's always chewing sticks and rocks and that. But I'm not sure if she's punctured something or got like a hole from chewing or something.
I'm just going to have a look in her mouth and see if we can work out exactly what's causing this problem.
Oh,
doesn't look good. It's only when I open up her mouth that I notice that her canine teeth are sitting far back and they're actually digging their way up into her palate, and that's not normal at all. Those bottom canine teeth, they're actually not sitting where they should be, and what they're doing is they're burrowing up into her palate and they're making those little ulcers, and if we don't do anything about it, those canine teeth will just progressively burrow through her palate, and eventually, in the worst case scenario, they can almost make holes right up into her nasal cavity. That's pretty bad. Yeah, it's pretty serious if we get to that stage. The best thing we can do is try and treat her now so that it's not going to progress and end up with a serious surgical problem. If we don't treat it, it's going to cause her lifelong pain, discomfort, difficulty eating. It's something we really need to treat straight away.
It's okay. She's just a little baby, so we want to make sure we can do whatever we can to help her. Do the best.
The name's very African. I should have known.
A surprise for Chris has been brought in by Donna and Amanda.
Yes, that is an African name.
They're from Lottle, a specialised welfare home for retired zoo and circus animals.
I think Dr. Chris was extremely surprised when he saw Sammy.
No, he didn't. Oh, no, trust me, he did.
He was not expecting a lion cub to come out of that little carrier.
I guess the question is, how? How do you have her, and what is she doing in here now?
Her mother, Tanza, was acting a bit strange with her. Being the first time mum, she was picking her up a lot, pacing back and forth in the den, wanting to take her out into the big enclosure.
So she just showed quite anxious behaviour, did she?
Yeah, very anxious. She seemed a little stressed. We just got too worried, so we thought it was in her best interest to be hand-reared with us.
Absolutely.
When Zambi's mother threatened to harm her, Donna and Amanda became the cub's surrogate mums.
There's no doubt that Donna has done the right thing in taking Zambi away from her mother. It's not ideal, but the reality is, kept in that situation, the risk of injury just becomes too great. My hope is that you got her away from mum in time, and we can transition her into, I guess, her new life.
Yes.
The first priority really is to establish that she is healthy. She's gone through a lot, so ensuring she's at a good point now can set her up for the rest of her life.
Hi, this is Callie. Hi, Callie. And Alana. Hello.
At Sash, 7-month-old Callie has a big problem inside her mouth.
Alana noticed that she had some little craters on her top palate.
Lisa is hoping specialist veterinary dentist Nadine Fiani can find a solution to help the staffy.
It seems like her lower canines are not occluding in the way that they should. They're just not lining up. But I'd love your opinion on what we can do.
Let's have a look inside. Let's open up that little mouth. Wow. See the dents right in the roof of her mouth? That certainly does not look right at all. Wow. So this is a pretty nasty problem. You're absolutely right, Lisa.
The first thing I could see was that her two lower canines, her big fang teeth, instead of sitting in this sort of angle, they're actually sitting a little too upright. They're standing up. And what that means is when Callie closes her mouth, those two fang teeth are now poking up into the roof of her mouth, and they're causing dents. They're causing indentations or trauma to the roof of her mouth.
Is there something we can do to help her?
She's very lucky. I think we can probably put on some doggy braces.
I did not think that they were going to say that she needed braces. I'd never ever heard of a dog with braces.
So is it like human braces?
They're a little bit similar to what people can have sometimes on their teeth. We're going to move her upper canines back, and once there's a bit more room, we'll try and shift the problematic lower canines out of the way so that she's not having that painful problem anymore. We're not trying to make her win a beauty contest. We just want her to be comfortable.
Yeah, I don't want her to be in pain, so.
Oh, that's good.
But she's the most loved member of our family, so anything that she needs, I will do for her.
Callie will be a pioneer and one of the first dogs ever to have braces fitted at Sash.
Callie's provided us perfect case for it. And the beauty of this procedure is that it's completely non-invasive.
As horrible as Kelly's problem is, the exciting thing is we can put braces on her to fix this. Now you're going to get braces on very soon.
Stage 1 of Kelly's orthodontic treatment will take place later this afternoon. For now, it's time for Alana to say her goodbyes.
We'll see you soon. It's pretty amazing that we can do this for her. I'm sure some people are going to think I've lost my mind putting braces on my dog. And they might sort of think I'm just doing it so they look pretty. But we're going to do this so she isn't in any pain anymore.
Is it tasty? This is the only line I let bite my finger.
At the Bondi Clinic, Chris needs to examine Zambi. After being rejected by her mum, the little line cut is being hand-raised by Donna and Amanda. They need to make sure she's healthy.
Her heart sounds good.
Oh,
Yeah, heart sounds nice and strong. It's a really critical time right now because without the antibodies coming in from her mother's milk, she's at risk of infection. And that can be from bacterial infections or it can be from viruses. So what I would actually like to do today is give her a vaccination.
Okay, her first vaccine.
Yeah. We're really throwing out the rule book by giving Zambi her vaccination at 4 weeks of age, but I wouldn't figure myself if she got an infection now, it could have been prevented by vaccination. It's a risk we have to take.
I'll give her my pacifying finger. Oh, here we go. There's exactly. Oh.
Okay, so that's going to make us a little bit more relaxed about her being protected from infection.
Yes.
The other thing she needs is something you can't give in a bottle or in a needle, and that's socialisation. With all this focus on how healthy Zambi is medically, it's easy to forget her social needs, which are just as important. She needs to learn to be alone. If she's not in a pride because she's not with her mother, that's where it becomes a bit tricky for her. But what you can do, and this isn't easy, what you can do is actually give her a pride of her own. She can't go into lines because they'll probably tear her apart. But what we can do is try to find animals that will accept her but still have that team environment. What I'm talking about are dogs.
Yes. I think we might have the dog. Give her that. I know which one you're thinking of, Sabi. Yeah.
What's Sabi?
She's a Labrador.
Yeah.
Yeah. But she keeps everyone else in line at home.
Yeah.
So, I mean,
When Amanda tells me that her dog is a Labrador, my eyes light up. We are talking about the most perfect surrogate out there. Not only because they're obliging, they're understanding, they're patient, and they're very loving. It's a little bit crazy. I know it sounds a bit weird, but there are situations where this has been done around the world, and it has worked very well. But there's no guarantees.
no. She could turn her nose up and say, no,
Yeah.
not dealing with that.
Giving Zambi a surrogate mum in the form of a Labrador could potentially be the greatest thing for her, but sometimes these things don't go to plan. I need to be out there to make sure this doesn't go badly.
The idea is that she's going to thrash around, she'll build up like a gator.
At the Australian Reptile Park, Operations Manager Tim Faulkner and his staff are preparing for an extremely dangerous capture.
Well, let's be safe and... Okay, we'll meet you around the front, guys.
The park's keepers have recently noticed Atomic Betty, a massive reticulated python, has a large lump on her back. Tim must catch her to have a closer look at the worrying growth.
There is no easy way to catch Atomic Betty. You'll know what 3, 2, 1. Good boy. In. Head up. Head up. Head up. Everyone grab on. Feet her out. Feet her out. Feet her out. Atomic Betty is a member of the largest python species on Earth. Now, at her size, a bite, teeth are a centimetre long, serious cuts, and if she gets a coil around you, you'll hear ribs pop. What's that, Henry?
After a tense struggle, They've managed to capture the massive 6.5 metre python.
Okay, so bring that bag in. Tail's going to go in first. Starting to bring the bag a bit closer, guys. 3, 2, 1, go. Beauty. Wrap her up. Atomic Betty is one of the reptile park favourites. You think that something's wrong with her? I don't like it, and it really worries me.
Excuse us, guys. Cheers, thank you.
Atomic Betty has been moved to a safe area for examination. Tim is aware the python is now extremely agitated and will be ready to strike when the opportunity presents itself.
The first year I ever caught her, I went in and I was about a metre away and she just launched at me. And she got a couple of teeth through one of the keeper's nails and it was horrible, blood everywhere. So we always have to be aware of that and manage her very, very safely. Okay, now there's only 4 of us, so let's go up and out. You with mate? Whoa. You got it, mate?
Yep.
Just take her over to your left there.
Yeah, like we can go down so she's on the ground.
Okay, that's nice. Oh, look at it. Yeah. Okay, so that's pretty serious. Yeah. I'm really worried about that, mate. I can see that and feel that there's bone. Man, it's raised, so she needs to go to bed. All right, guys, let's get her back in now. Softly, gently.
So she's going to go.
Good, that's almost in. 2 boys on the head.
Yep.
Atomic Betty's never been to the vets before. She's not the type of animal that we'd take off site and get out in a vet clinic, but, you know, this is serious enough that I need to do it. Okay, that's good. She's good. What I really don't want is bad news. Atomic Betty is a beautiful big snake, and surgery would be just a nightmare.
How you going?
It's like
Some of the relatives over here.
it is. Thanks for coming out. We really appreciate it.
No worries.
Chris is at the Lottle Animal Rescue Centre in Western Sydney. He has a left field idea on how to help 4-week-old Zambi.
All right, should we go and introduce little Zambi to the new mum?
Yes, let's do it.
The tiny cub is being hand-raised by Donna and Amanda, but she needs to learn how to become a lion.
My plan is to do something that seems a little bit strange at first. We're going to try to give Zambi a new mother in the form of a Labrador. What I'm thinking is I'd love to meet a new mum first without Zambi being around. So something I want to try that I think is going to ease this introduction.
Why don't you take Chris to meet Zabi? Maybe? Oh,
Which way is she?
she's just up here.
Who's it going to be, huh?
There's no shortage of volunteers for the surrogate role,
Here she is here.
She's in there.
Yeah?
but one special lab has been singled out.
Calling Sabi.
Zabi? Good girl.
That's a good start.
Labradors are known for their maternal instincts, and Chris has big plans for Sabi.
The hope here is that we can create the feeling of a pride of lions. How we're going to do that, though, I haven't told the girls. There is a bit of a trick here. Dogs make up their mind about things as much on the scent of them as they do on the sight of them.
Okay.
So, that's where this comes in handy. So what we're going to do is take Zabi's scent from her body and put it on Zambi. So when she smells Zambi, she's going to go, ooh, that cologne is strangely familiar.
This is the best part of
She's loving it.
Huh? It's not a motherhood thing. It's not seeming too bad, is it? Okay. Let's have a child started.
Oh, wow.
So the challenge there. Post-its. Alright. Donna, I think we're ready. Okay, so my plan is, this is covered in sunset.
Oh.
What we're going to do is rub this all over Zambi. So, we're essentially trying to fool Sabi into thinking Zambi is a Lion-ador.
A liner job. Love it.
Part lion, part Labrador.
Oh, it's all right.
Zambi isn't too sure about suddenly smelling like a Labrador, but Chris is hoping his gamble will work.
Right now, all the groundwork has been laid. We have Zambi, who smells like a dog. We have Savi, who looks like being the perfect mother. I'm excited about how this goes, but at the same time, I'm a little bit wary. This was my idea. If this doesn't go well, I could be leaving here in a hurry.
All right, sweetheart. I'm gonna go to sleep.
At SASH, 7-month-old Callie is about to undergo the first of a series of complex procedures to fix her misaligned teeth.
If we were to leave Callie's mouth as it is, it's only going to get worse. And what will happen is those two lower canines, those two lower fangs, are just going to keep digging deeper and deeper and deeper into the roof of her mouth. Wow. Right the hole. What we're looking at here is the trauma that's happening in Callie's mouth. So these two dents in the roof of her mouth are caused by the lower canine. Every time she closes her mouth, they poke straight into the roof of her mouth. So that's really uncomfortable. So our aim is to eventually be able to move these two canines outward so that they're sitting on the side of the jaw rather than inside the roof of her mouth.
The first step today is applying braces.
We're going to cement on some metal buttons onto her teeth. It's a very delicate procedure, and where they go is very, very important. We just need to let that sit for a minute.
The buttons will hold elastics that will start moving the problem teeth to their correct position.
We have to be very, very careful with how much tension we apply to these teeth. If we put too much tension, if we try and move that tooth too quickly, it could end up killing it, and that's not what we want. That could lead to a whole host of problems. So we have to take our time, we have to measure everything, we have to make sure what we're doing is spot on. There we go.
Stage 1 of this long and complicated process is now over.
The buttons and the chains look great. They don't feel like they're going to come off, but she is a puppy, and we have to be so careful with her, so she's not allowed to chew on anything, because they can come off quite easily.
Oh, it's all right. Callie will sleep off her sedation and hopefully be able to go home with her owner Alana later today.
Hello, mate.
Afternoon, Timmy. How are you?
Good, thanks, mate. How are you?
Near the Reptile Park in Wyoming, Tim and the team have arrived at the Green Cross Vets Clinic with Atomic Betty.
Oh, you got it?
Yep, I've got it. The 11-year-old python has a large lump on her back. Tim is hoping Dr. Peter Nosworthy can determine what's causing the massive swelling.
So we're mid-back with this. Do we have to get her all the way out, do you think?
I think she'll be better up there because it's just better for us with restraint.
Now, keep coming a little.
Here we go.
Comes up now, Pete. That's it.
Yeah.
She got a bony bump.
What is it?
Oh, what's bone? Oh, truly.
What's your first?
Oh, well, first impression's a worry. Touching Betty's lump, I'm concerned that she suffered a fractured vertebrae in her back and that there's the potential to her to be paralysed from that point backwards. We need to have a look at the spine to see whether we've got a straight line vertebrae for a start, that there's no disarticulation.
Yes.
Appreciate that. If that's the case, then we've got impingement on the cord.
Yes.
And from there backwards, we're going to have nerve issues.
So what are we going to do now?
Yeah, I want to take an X-ray, if that's all right.
Yeah, sure. We might just carry you through while she's out.
Yeah, if you're up for that, that's good. Right. We've got the weight back here.
I'm really nervous. My stomach's in knots. And that's because the worst case could unfold. A bit more, Mickey. A little bit more, mate. That's us. Yep, we're good there. If these results are bad and she has a broken back, that could end in paralysis. And that's the end of Betty. We don't want that to happen.
X-ray's happening, guys. 1, 2, go.
Do you want us to turn her a little?
Atomic Betty's X-rays are underway.
Okay, good. She's done.
She's done.
The 6.5-metre reticulated python has a worrying lump on her back. Tim's concerned Betty might have broken her spine.
Atomic Betty's a really important part of the Australian Reptile Park. She is so loved that for anything to be wrong with her,
We haven't got a lot to smile about. She has a crack. A vertebrae. Okay, you can see this is bone. That bone should be sitting like, you can see how the vertebrae come up there, that should be sitting. Same as this, they're all sitting next door to each other.
Yep.
One sitting up in the air, which means that we have got some pressure on the underside of the spinal cord.
So, Pete, now, are we still looking at a real risk of paralysis?
Oh, without a doubt, yeah, we're looking at a risk of paralysis. If it's left to its own devices, it's left calm, quiet, it may well cement up beautifully. And it's like having a fused joint then. That would be what we're after.
But it will take 6 months for the bones to heal, and the team will have to follow very strict instructions so the python isn't paralysed.
No climbing, rest, small meals, and
Well, I'm not sure whether that's good news or bad news. I guess it could have been worse.
could have been a lot worse.
It could have been worse. I'm really happy that we brought her here today because till we got those x-rays, we couldn't know the severity of the injury. So, you know, we could have been on the knife's edge where she was about to become paralysed, and maybe by not feeding her big items now and the couple of things we're going to implement, we saved her. Okay, let's go.
At SASH, Pioneer patient Kelly has recovered from her anaesthetic after having a set of doggy braces fitted. Specialist veterinary dentist Nadine has given her the all clear to go home with owner Alana.
That's your mommy coming to get you. Callie is doing amazingly well this afternoon. You wouldn't even imagine that she was anesthetized only a couple of hours ago. She's right out of that anesthetic, no problems at all. Oh my goodness. So much for sedation.
I cannot believe that my dog has braces. I think it is so funny, but hopefully it really, really helps her. So I'm pretty excited.
Hello. Beautiful.
Kelly's next visit will be in 4 weeks.
Oh, thank you for that. That was lovely.
I really do hope that we start seeing that upper canine tooth, that upper fang tooth start to move back gradually, and to do so in a slow and steady fashion, and that we don't end up with any complications from it. Bye, good luck.
At the Australian Reptile Park, Tim and the keepers are carefully returning Atomic Betty to her enclosure.
She's heavy.
The 6.5-metre python will need to be handled with care to avoid any more damage to her fractured spine.
It's been a big day for Betty and keepers, but now we know what's wrong with the lump. We know what we've got to do to fix it. Betty needs to get back in her enclosure and just settle down. She needs some rest. Okay, that's it. All right, Betty. I think at least for another year, she doesn't need to be handled. We'll reduce the food items, so hopefully that's enough to get her through. Righto, darling. All you got to do is get better now.
So just remember to take it nice and slow. Obviously, Zambi's never really seen one like Savi before, and Savi's never seen one like Zambi before, so you just try to go in nice and slowly.
At the Lottle Animal Rescue Headquarters in suburban Sydney, Chris is about to find out if his bizarre adoption plan will work.
It's been nice and positive, hey?
He's hoping Savi, the Labrador, will become mum to this 4-week-old lion cub.
I am anxious about this. It could work one way or the other, and Savi could not want anything to do with the cub at all, or her maternal instincts might kick in, hopefully, and it could all turn out beautifully.
Just nice and slow, nice and slow. Just mix. There we go. There's certainly no stress or anxiety there. That's a full-on first meeting, but that is a successful first meeting.
Gentle, just a little.
I could tell that Sabi had love to give, but just how much love to give, that was a surprise. But what I find amazing is that she's looked at Zambi and hasn't seen a lion. She's seen one of hers almost that needs help.
I mean, this is a fantastic result, Chris.
It's extraordinary.
I think Chris's idea with the scented cloth helped out lots. She just jumped straight in there and just started being a mother to her.
So, as a first meeting, that really couldn't have gone any better.
Sabi and Zambi will spend the next few months living together. The hope is Sabi will teach Zambi how to live in a pack and set her up for the rest of her life.
After such an enthusiastic first meeting between Sabi and Zambi, it'd be rude not to come back and see how this relationship develops.
Sleepy. There we go.
At SASH, the second stage of little Kelly's marathon orthodontic program is about to begin.
It's time to get these braces off.
If the braces have done their job, Kelly's upper canine teeth should have started to move back.
Oh my god. Right, it came. Beautiful.
Tally still has those little ulcers in the roof of her mouth, but it's looking pretty good and no longer causing her any pain or discomfort.
The next step is to use dental paste to construct a temporary plate that will start pushing Kelly's lower canines clear of the roof of her mouth.
We want to make sure that everything fits together and that you shift the teeth as quickly and as efficiently as possible without causing any problems later on.
Little Kelly is now more than halfway through the pioneering program to correct her teeth.
Very, very nice.
It will be another 4 weeks before she's back in to see if the plate has worked.
Now we'll just have to wait and see if the teeth shift like they should be.
Outside the Bondi Clinic, Cassie is losing the battle for her bulldog George. But the 2-year-old might not be so enthusiastic about his visit to the vet if he knew just what was in store.
Ashamed to sit up with Chris because concerning about finally dissecting him because he's getting out of control. I love his personality. It's just I want him to calm down. It's just too much.
Hey, how are you?
Hi. Oh,
Hello.
Georgie.
Hi.
He's very excited to meet you.
It's been a few years since I first saw George as a puppy. In that time, the little boy has grown up. Wow, okay, he's a bit of a hurry. Look at this one. Look at that one. He's a totally different story now. Does this have anything to do with what you...
He's getting a bit out of control, though. When I take him for a walk, it takes forever because he sniffs every single tree. And I'm not sure if I dissex him, he's going to change because it's not enjoyable to take him for a walk anymore.
There's no doubt that George has an excess energy problem, but it's the engine that's driving this beast that is the true issue here. We've got engines, two of them. The problem's right for our eyes.
So you can actually walk it out to the curb.
Do what?
You could actually bring the water bottles down, put them in the trash can, and walk them out to the curb.
Alright.
No, the recycling hasn't come yet. Let's get
Mom, can you please help me out?
Zachary, you haven't gotten any exercise for days.
Oh.
Days. Dang.
What? It's kind of cold outside.
No, it's warm out. It's like...
Mom, you just came up here. Can you please just do it?
It's your job.
Disney. There you go, Captain. Today is a huge milestone for Courageous Kelly. Where after weeks of intense treatment at SASH, the staffing pack is back for what's hopefully her final procedure.
We're going to be removing her orthodontic appliance today. Hopefully that'll be it. We'll be done.
The first step is removing Kelly's plate.
We're going to split the appliances apart so that get our fit height. We do that very carefully because we don't want the holes to fall. So you can see immediately that her lower ligaments are relaxed. It's moving up to top. They're just sitting right in there, inside the mouth. So we're holding in our final over kiss. The braces, the plate, everything's going to work really completely right. So we've got constantly
Just believes Gorgeous George's testes are producing too much testosterone, leading to his dominant and uncorrected behavior.
By castrating George, you take away that testosterone. You make him less answerable to those urges, more focused on body protection, and movement and control.
Cassie isn't convinced.
In your way, it might change his personality.
I'm worried it's going to change his personality. I'm worried he's just going to be upset.
So, I can tell you that it will be but it's still a bit bigger. If I was to have my 2 cents here, I would say that you were the best option. He's the most prominent is to actually stop.
Cassie doesn't seem ready to commit just yet.
If we do the surgery, very slowly.
So just work out, so it's either in the morning or you guys come in
So for now, Gorgeous George's manhood remains intact. Later that afternoon, Kelly has slept off her sedation and is ready to continue the day with her devoted owner around.
I have been through weeks and weeks of procedures, and her devotion and dedication to her daughter is beyond me. I just can't wait for her to see her.
Dude, so flipping stupid.
So it's definitely worth getting the puppy braces for Callie. We can be happy knowing she's got a long, happy, healthy life ahead of her with plenty of love from all of us.
You buy them, you love them. You'd hate to see them fade. With OxyClean Dark Protects, fight fading and help keep your favorite dark.
You know what? I'd rather spend time to catch up with a girl that hasn't been too easy to forget.
Chris is on his way to the local animal rescue headquarters in Western Sydney to check up on Zambi, her Ryan pup.
Oh, I love my next little girl. You do.
Yeah, what a creepy.
When I first see Zambi running towards me, I'm thinking, she's grown up.
The last time Chris saw little Zambi, she was just 4 weeks old.
She's about as good as it gets.
The tiny cub was being hand-raised by Donna and Amanda, but needed a surrogate animal mum to help her develop socially.
You think of the last time?
Just a little.
Now Zambi is 5 months old, Chris wants to see just how his left-field idea of having Sabi the Labrador raise the cub has worked out.
Oh, hello. The whole family's here. Hello. Hello. So, was she the mother you wanted?
Oh, she's been wonderful. Yeah, she's been toileting her for us. She keeps her company, sleeps with her.
She's making a growl like a lion. See, she has
See,
to
they picked up a few things. Sabi's a great one. Yeah, I couldn't have asked for any better. She looks after her, she sleeps with her, and she's very protective of her. She is the best one to look after.
So, you gotta say, we took a punt on you. Huh? We really took a chance on you. We probably asked a lot more of you than one should ever ask of a dog. But you delivered. Bringing Labradors and lions together was always going to be a calculated risk, but it could have been done. So now we look at you. Maybe that's what happens. Huh? Now you can't leave with a fresh leg. Oh, this is a great game, isn't it? Huh? It's a perfect game.
This was going to turn into a
It's a little chew it. I don't hear your heart, I just hear you chewing. This sounds good. You've been very cooperative now. We didn't talk about one thing. It's been on the phone too well. I know you've got to, so his vaccination plan. There's lots of times where they remind you that a lot. Not a dog after all.
Perfect. Well done. It's a big relief. She's in great health.
But I must say, Sabi's done a wonderful job.
Yeah, thank goodness. It worked a treat that we could put Zambi with the Labradors. It would have been really hard for a human to take over that role as her mum. They've just been so good to her. I couldn't have asked for any better.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell.
There they are, the perfect pair of black jeans. And you'll do anything to keep them from fading in the wash. With OxyClean Dark Protect Laundry Booster, now you can help keep your favorite darks dark. Fight fading with a shield of powerful protection and extend the life of dark clothes.
Yes!
She's walking with me. Maybe I'm just a sucker for punishment, but I can't seem to keep away from this part of far north Queensland.
Chris has left the surrounds of Bondi for a working holiday in tropical Cairns.
Up until now, each of the trips I've made up here have been pretty quick visits to the operator of goldfish, to help a bull, and to even try to catch a snake. Honestly, I've made a bit of an impression because these guys have asked me to stay up here for an entire week, helping them out with their clinic. This could get interesting.
The doc is answering a call for help from his old mate Dr. Doug English, who runs the busy Marlin Coast Veterinary Hospital.
Chris,
how you going?
Good to see you. Mate, I'm nervous. Is it fish up first?
No, the fish is right. We can fix the fish. He's going well.
The last time Chris was at the clinic with Doug, he was thrown in the deep end.
If Faye's oxygen levels fall too far, then he won't make it through.
Local identity Fanny the goldfish
Hello?
required a risky operation to remove a large tumour from his head.
Maybe.
Decent one.
We're going to set you up in that room there, and we can go ahead.
I'm in Arena Solo right now.
Thanks, mate. I'll just get in here now.
I'll play after
Chris
them.
gets a chance to settle in. His first patient of the day is waiting in reception. Amanda and her son Jesse are extremely concerned about their beloved Jack Russell, Snoopy.
I'm here because she's just recently started doing a lot of frothing in her mouth and really irritated, and then she started throwing up.
So tell me, what's been going on with Snoopy?
Last night, she just started. She's done it a couple of times, but lots of frothing and red lips, and started to throw up, and just was really ill afterwards.
Is it the first time it's happened?
No, not the first time. We've actually got some footage of her when what was going on last night.
Yeah.
You want to see that?
I'd love to. You can see that saliva really building up. It's quite full on times, isn't it?
Yeah, it's not nice.
Clearly something's affecting her body in a big way. So the mouth looks okay now. That's the interesting thing. The colour's fine, and then she's producing just the right amount of saliva. She doesn't get dehydrated. So.
And her eyes, she kind of gets a really glazed look in her eyes. They look fine now too.
The confusing thing for me right now is that Snoopy seems quite normal. Yeah, sure enough, that's fine as well. So Snoopy right now is a perfectly normal girl. When she has these episodes, she sounds like she's in pain. She's in a confused state. She's hypersalivating. She's pouring her mouth.
Yeah. And the other interesting thing is there's two of them, and the other one doesn't. That's not going on.
Yes, that's amazing. It's hard to know exactly what this could be, but when you look at those signs, you've got to think she may be having either a mild seizure, she could be being poisoned by something, she could be eating something she shouldn't be. Right now, though, it is a complete mystery. There's something very unique to her that's happening. I guess, for me, the thing that I really need to do is actually see what happens in her backyard, because something's happening. It's happening more and more often. It's getting more and more serious.
Yeah.
Chris is planning to check up on Snoopy later. He's hoping a home visit will provide vital answers to the little Jack Russell's bizarre attacks.
So I do think we need to sort this out and actually sort it out now.
Yeah.
New Vitafusion organic gummy vitamins are so yummy. It's like getting the benefits of meditation on vacation. New organic gummy vitamins from Vitafusion. Vitamin better. We're so organic.
Welcome to the 40th annual Odyssey of the Mind World Final!
Hi, I'm Lisa. Hi.
Mrs. Smudgy?
Nice. Poor little guy going his through. Let me have a look at him.
At the Bondi Referral Hospital SASH, Lisa's first patient is 7-year-old Smudge. Owner Jane was distraught when Smudge went missing almost 2 weeks ago.
I didn't know what had happened to him, and I couldn't find any high and low for him. And I was starting to get very concerned as to what had happened to him and his well-being, and if I would ever see him again. And
Alright, well let me take a look at him.
After 12 days on the run, Smudge suddenly reappeared with a mysterious leg injury.
Snakebite was a concern, whether he'd been attacked by a dog or something else, or even possibly being knocked by a car.
We kind of just have to look at him and try and get some clues as to where he's been and how he got injured, and just work through each part of his body. That is shocking.
Yeah, that's what I thought.
This leg is just sort of flopping in the breeze there. He can move it, but it's completely unstable. That's a little tear as well. Wow, look at that. When I feel Smudge's leg, there is crunching under my fingers. There's a wound that's oozing pussy material. My worry is that he's broken that leg and it's infected. I'm concerned that that wound has penetrated into that fracture. He could lose the leg from that infection. His whole body can become unwell. Oh, poor baby. Hey, Shane. Good morning. Hope you're well today.
Little Konya, we're here to see Dr. Chris.
Yeah, great.
Thank you.
Back in Cairns, Peter has arrived at the Marlin Coast Vet Clinic with Sunny, a tiny 8-week-old sun conure parrot who is unable to use his right leg.
So here we have a sun Konya from Bird World in Corinda, and it was presented with a very sore leg. We feel it's got a cord on something at some stage, and that's what's done the damage to the leg. This one in particular, we've all become really attached to at Bird World because it is just so friendly and really craves that interaction.
Hey, how are you?
Good, how are you?
I'm Chris.
Peter.
Hey, nice to meet you, Peter. Little sun from you in here?
Yeah, little sun.
Well, come on through. It's always a worry when baby birds are brought into the vet because they're so small, they're so fragile that any sort of fall from a nest or a perch, it usually doesn't end up so well. But he's just starting to try to learn to fly right now.
Yeah, he's just been flapping his wings a lot and really starting to explore his territory.
So is there a chance he was trying to fly when he was into that level?
There's every chance that he may have been flying.
Yeah. The first thing I want to do is probably the most important thing. So you can see when I put my finger near this left leg of his and grabs it, it's going to check his perching reflex. So obviously in that leg it's great.
Yeah.
But if he doesn't have a perching reflex in this other leg, he'll have problems. So to see if we're getting some sort of response there. There's not a lot. And that does worry me that we might have some nerve damage. It's clear that when Sonny hit that ground, he hit it hard. Now, the worry I've got right now is that if he's fractured that leg really badly and it can't be put back together, then there is a chance this leg will need to be amputated. I can actually move the bottom part of that leg separately to the top part.
Oh, that's not good.
Yeah. He's remarkably relaxed. His heart rate's actually quite low.
Yeah, he's a very chilled out bird.
Sunny is the most appropriate name for him.
Yeah. Just loves being around people and having that attention. And loves a scratch.
Really loves a scratch.
Yeah.
It's easy to see why Peter cares so much for Sunny, and he's not only a stunning bird to look at, he's also incredibly friendly. But the reality is, with his paper-thin bones and a fall from any height, there's a chance these bones could be fractured beyond repair. These toes are really pointing straight out, whereas these ones point right around. So he's got a problem there that foot's actually able to skin. which isn't nice. I can feel and poke and prod as much as I like, but it's very hard to feel the exact structure of those bones. They're so small. So I think, if you don't mind, I might take an X-ray now and hopefully get some answers.
That would be great.
That bone is completely smashed. It's just in so many different pieces. That is shocking. What has Smudge done?
At Sash, Lisa is stunned that Smudge has survived his runaway ordeal with such an horrific injury.
This cat has been missing for a couple of weeks. His leg is smashed to pieces and he still managed to walk home, eat a full meal, and give his owner a cuddle. I mean, it blows my mind how brave animals are, and we really owe it to Smudge to fix that leg and get him back on track. He must be feeling very sick. Hey, Steve, could you please look at these radiographs?
Lisa wants to see if specialist surgeon Dr. Steve Fernside can fix the nasty break in Smudge's leg.
Oh dear, that's smashed, isn't it?
Yeah,
So I wonder he couldn't get home.
Yeah.
He was stuck out in the bush with that.
Well, there's a wound over the fracture that's oozing pussy material as well, so I'm worried it's an open fracture that's infected now.
Well, all we need to do is get him anaesthetised, and then we'll have a look at his wound and assess that, and then we'll work out how we're going to fix that fracture, because that certainly is not going to heal without some fairly major intervention.
Steve and the team need to act fast if there is any hope of saving Smudge's leg.
So brave. Whenever one of my patients is handed over to the surgeons, I always feel a little bit worried, but I know Smudge is in good hands.
We can't get this fracture healed, or the bone won't heal, we just can't align it properly. The bone is too badly broken. Worst case scenario, Smudge might lose his leg.
Let's get to X-ray this guy's leg here.
You buy them, you love them. You'd hate to see them fade. With OxyClean Dark Protect, fight fading and help keep your favorite darks dark.
These new Vitafusion gummy vitamins are organic, like farmers market organic, like baby goats and toads organic. Want to know what else is organic? Farmers. New organic gummy vitamins from Vitafusion. Vitamin better.
Right, so this one's a little bit tricky. Let's see.
At the Marlin Coast Vet Hospital in Cairns, Sonny's X-ray is underway.
Alright, I'm pretty happy there. Oops, maybe on again.
Chris is worried the 8-week-old son Conure has fractured his leg in a failed attempt to fly. Vet nurse Shannon is assisting Chris.
1, 2, 3, go. Perfect, thank you. Okay. Hey, I'm out there. It's alright, buddy. Still concerned to move, aren't you? Let's have a look.
Looks like a nice break there, doesn't it?
Yeah, that's kind of what I feared. Alright, thank you. I'm going to have a chat with him. Cheers. Alright, so, I have some news. That leg isn't dislocated, but it is broken. Yeah. The worry I've got is if I try to put a pin through there, it could quite easily fracture the bone even more, cause it to splinter. From there, it may never come back together. I think the best approach here is to try to actually split that leg. It's a lot more gentle. You're actually doing everything from the outside, leave the rest up to Sonny. I'm going to give him a little bit of an anaesthetic, just so sleepy, so still, and then do my best to try to put this leg back together. I'm already concerned about possible nerve damage in this leg. The last thing I want to do is manipulate the leg too much and cause more damage. The less risks we're taking Sonny right now, the better. Bad break. Yeah.
Chris is hoping a splint will help the baby parrot's fragile bones heal back in place.
Probably no better way to tell if Sonny's asleep than this. Apologies, Sonny.
that was good.
It's a bit of the worst leg waxing all the time. If there's a downside to using a splint, it's probably not as stable as using a pin, but at the same time it's safer. You can really see this how swollen and also how discoloured that leg's become since this break. That's what we're really dealing with here, is just how much inflammation is around this area.
Before Chris can splint Sonny's leg, he must accurately align the 8-week-old's broken bones.
Okay, so we're just putting some tape in here just to lock this in place initially.
If this first stage is not done correctly, Sonny's leg will not heal.
It is incredibly fiddly, just you're dealing with such a small leg, and everything is made so much more difficult by that. Alright, first layer's in there now, so this is probably the most crucial part. This isn't just a matter of getting some tape and some splinting material and hoping for the best. If this is going to work, it has to be made to measure. I'm working down to the absolute millimetre here. So now I'm trying to stick this splint to the leg, and it's once again quite fiddly, but hopefully this will work. Having such dainty little hands can really help.
Suddenly, Shannon notices an alarming change in the tiny bird's heart rate.
Birds like Sonny have this tiny little heart that beats as fast as it can, but it can stop at any moment, and as a vet, that's what we fear most.
Sonny is now in serious trouble.
It's really quite a tricky procedure, so there's going to be a fair bit of grunting and a little bit of swearing, and we'll get this back in a position.
At SASH, Specialist Surgeon Dr. Steve Fernside is starting the complicated surgery to repair Smudge's smashed leg.
The bone should line up like that, and basically the bone is lined up like that. Right, I'll start this bone off.
Steve will use pins to form a brace around the break.
Right, so far so good. First pin we placed through Smudge's bone, just below his knee. So what we're going to now do is place another pin just here above his ankle, and then we're going to use those two pins to pull the bone apart to try and put it back in alignment. See how we go.
With the second pin in place, it's time to see if the bones can be realigned.
Alright, let's have a look and see if this works. It's just amazing. Oh. Okay. Stretching it. Oh, that bone is really stuck in there tight. The bones are so badly displaced, they're not even in the same ballpark. They don't want to go, but they've got it.
In Cairns, Sonny, the little sun conure, has given Chris a scare during the surgery to repair the crowd's broken leg.
He's just lighting it up.
Yeah, because he's a bit fast to know when doing this.
The worry with bird anaesthetics is they can actually go quite deep too quickly and you can lose them. But if Sonny's doing anything right now, he's actually a little bit light, so he's almost more awake than we want. So try and be quick, but at the same time get it right, because he's probably been under anaesthetic for long enough now. this split is that it'll keep the bone in Sonny's leg still long enough for it to heal, but also keep his toes in the right position. If we do all those things, then hopefully that perching reflex will start to come back.
Don't think a cat's going to be that hard to put back together because they're only small, but so much muscle contracture there. Pretty hard to put everything back into the right position.
At SASH, Dr. Steve Fernside is struggling to realign Runaway Smudge's badly smashed leg.
That obviously should be bulging like that. I think we're going to have to go in there and just try and reduce it. Hang on there. This was the bit that's poking out nearly through the skin, and that's the other bit up there. They've been locked out of position for a couple of weeks, and they've all contracted around, and we just can't get the two pieces of bone to come back like that. And we've had to try and pull them out together like that, and then we're going to try and push them together and straighten them out like that. This poor little cat. As long as his knee and his ankle line up, then we'll be right.
That's all right.
Pretty close. I'd be happy with that. That is not, it's not bloody gun barrel straight, but gee, it's not far off. His leg is back in alignment. His knee and his ankle are in alignment. He's got good movement of the leg. I reckon that's going to work.
Smudge will be stuck with a leg brace for at least 6 weeks. It won't be removed until the fragile bones are fully mended.
I've just got to get it there now in that position.
Nothing to say.
In Cairns, after a death-defying fall during an attempt at flight,
Let's get it.
Sonny is now ready to return to his home at Birdworld Kuranda.
Alright.
Chris has put a splint on the Zunconyeur's tiny leg. This should hold the broken bones in place long enough for the baby parrot to make a full recovery.
Are you getting the back? A loving feeling? Yeah, that's what I thought. Peter's here to pick you up. Yeah. But she won't pick you up if you pick at your bandage. Deal? Yeah. Okay, let's go, buddy.
Really looking forward to seeing Sonny. Really missed that bird bob anyway, so yeah, excited to see him come back and hopefully everything's gone really well.
It's here. Hello.
Hello, beautiful.
So, you're back, aren't you? So, you will notice that he's now wearing a bright red sock.
He is.
But it's a magical sock.
It's very pretty.
It is. So, it's a sock that's going to keep that leg of his nice and still.
Oh, that looks great.
And you'll find that, give it a bit of time, he's going to start putting some weight on that leg, but the fact he's not really using it too much right now is good.
Yeah.
Because it'll give him a good chance to heal.
That's wonderful. Hello.
Is that what you want?
Let's see if I can scratch me out.
Sonny's already had to deal with so much in his 8 weeks of life. His first flight didn't go so well, but I'm hoping with a bit of luck and a bit of healing, he'll be clear for takeoff pretty soon. There you go.
Thank you very much.
All yours. And a nice little present.
Isn't that smooth copy you're always telling me about? Oh no! What? Are you okay? What?
Hey! Now you're going in and you want to make sure to brake. Coming out that turn, you want to hit that gas. Whoa, hold on. Oh, even mess with the steer column again. Oh, shoot. That was supposed to be a surprise. I was going to buy you a new race wheel. You know, like one of the dog covers. I forgot to put it in. Come on, man. Cora Riley. Oh, and that's my best friend slash cameraman, Harlan.
Hi there. Who have we got here?
Vet nurse Liesl has brought her 2-year-old bearded dragon into the clinic.
Oh yeah, bring him in every now and then. He gets a bit lonely at home by himself. But that's fast.
While Liesl may refer to her cold-blooded friend as a he, she actually has no idea whether her reptile is a boy or a girl.
Hopefully we'll find out what sex he's. I mean, I don't think anyone here knows how to. It's not exactly as easy for a dog or a cat, but if anyone can, Chris can.
What's its name?
This is Zahir, Horatio, Samson, Althea, Tallulah, Phineas. It's hard to name when you don't know the sex.
Hang on, look at this now. Being called on to sex a bearded dragon isn't your everyday request. You can't just look for things hanging down. With a bearded dragon, what you're looking for are bulges. When you lift up the tail, if it's a male, you'll see 2 very subtle bulges just above the bottom. If it's a female, just 1 bulge. But quite often, it's really hard to tell. Or,
Take that.
oh, it just gets darker and worse as time goes on. I just can't believe she's gone 2 years without knowing the truth. Well, Liesl, I'd like you to meet Althea Tallulah. Good girl.
Oh, that's a little girl. I'm actually really excited that it's a girl.
You normally expect the it's a girl being shouted out to be at the time of birth.
Now we know she's a girl. Chris, tuck her up. Come on.
I've kissed words.
We picked her up on Saturday from a breeder in Canberra. Brought her home the first day. She's very bouncy, playing with everything. But then she's gone downhill from there.
9-week-old Kiko is being admitted to the Bondi Referral Hospital, SASH. The tiny Japanese Spitz puppy is suffering severe vomiting and diarrhea.
Mike's been sleeping next to her at night time and I've been.
Because we thought maybe distress was one of the problems, because you would cry a lot at night.
Worried owners Nicole and Mark have only had Kiko for 5 days.
Hello, Kiko. Now, what's been going on with her?
Brought her home on Sunday. She cried all night. Mark slept next to her.
Yeah.
She had 3 meals on Monday. She slept in the bathroom, but she was very distressed. She peed in her bed and still had diarrhea.
Nicole and Mark are very devoted parents. Kiko is their first baby. Nicole's been keeping a diary of her. They've hired babysitters. They are really proud parents, but unfortunately now they're very worried parents because Kiko's got a big virus. Dehydration can be a killer in a dog of her size. Basically, all the fluids being sucked out of her body and being lost in her diarrhea and vomit. And if we don't treat that, it can cause her body basically to shut down.
Hey, Tim, there you go.
Perfect day.
It's made
Is that me? Jeez, wet little darling.
Meg is a very sick, depressed koala. Her Joey died just a week ago.
Meg's 4 years old now. Last year she lost a Joey, and this year the same thing's happened. Sometime through the night, it gets out of the pouch, whether she throws it out of the pouch or it's exploring or something, but for some reason, by morning, it's so cold, we find the Joey and they're already deceased. I'm going to grab arms and hind legs. So all we need you to do is just keep your head up, and Chris is going to have a dig around in the pouch there.
The cause of Meg's pain is quickly discovered.
There it is.
Are you playing? I'd really like it if you'd cut.
Hi, Mom.
Are you in the middle of a game?
Yes.
When you're done, I'd really like it if you'd cut Cantaloupe with me.
Maybe.
Thank you.
Meg's got a dramatically enlarged mammary gland, so one of her little teats and the gland associated with it is a huge size. It's sore, it's hot, and it's a big concern because if that gland isn't functioning, she just can't support a young.
It's also the most likely reason why her last two Joeys did not survive.
I'll be thinking either a pressure build-up or mastitis. Meg is in pain, you can see it right across her face, and from what women tell me, mastitis is one of those awful conditions that just feel terrible. A real throbbing, awful pain that just won't subside. So we're trying to help her through that whatever way we can.
At the Australian Reptile Park, Chris has discovered that 4-year-old Meg has a severe case of mastitis.
Although I didn't want to have to put her through any of that, it's essential to get a good feel of that gland to see what's going on there.
The bacterial infection of the milk gland is an extremely painful condition that affects many breastfeeding women.
A bit of milk.
Yep, the grieving Meg lost her Joey only a week ago.
It's usually a streptococcus. Yep. It's into the jelly, causes infections in them. They don't thrive because their whole system's focused on trying to get rid of the infection. I mean, sadly, they die. The treatment for this is going to revolve around some nice warm compresses. So essentially some swabs, warm water, and just massaging that gland.
In behind the teeth there?
Yeah, getting right in there. If we can break up that clot and just make it into liquid milk instead of the solid milk that it is, then we can get it flushing out and right out the end of the teeth.
The antibiotics should kick in soon to relieve Meg's pain. Once the mastitis is cured, Chris is hoping Meg will finally become a successful mum.
Well, she's comfy.
She likes you.
I don't think it's me. I think I'm real skinny and I'm like a tree.
You got the tufts.
She's 4, so let's hope that she's just young and she's not sure what she's doing, and maybe next year with a little bit more maturity and, that she can keep a hold of one and, get one full term.
Lisa is taking a blood sample from the terrified Kiko.
It's a good girl. Alright, let's check what her glucose is.
She's hoping it will confirm her suspicion the puppy is suffering an extreme case of gastroenteritis.
Oh, that's low. She's got a blood glucose of 1.4. With a blood sugar that low at the moment, that would cause signs of exactly what she's doing now. So really flat, lethargic. If it drops lower, if it drops below 1, she's going to be at risk of seizures.
Lisa's now administering glucose into Kiko's IV drip, but she must go very slowly.
Puppies are such fragile little things. I mean, we're so much bigger than them. That she's 1.4 kilos, so we've got to be so careful with the amount of drugs we give her, the amount of fluids we give her. Everything has to be exact because there is so little room for error with these ones.
Yeah, go ahead, mate.
Yeah, mate, I'm out on the gate of it looks like Martha's got the big white.
Oh, you kidding? You're definitely Martha?
Yeah, definitely Martha, mate.
Righto, give us a couple of minutes, I'll go Chris.
Back at the reptile park, Chris's day just got more complicated.
Seems like Martha's been grabbed by another gator. She's one of our oldest, dearest gators, and she thinks she's a bit tougher than she is, so she's probably trying to fend off one of the big guys, and they just let her have it. Where's Chris? He's coming.
30-year-old Martha must be treated urgently before infection can set in.
You know the drill, mate. If we go in for any reason, yeah, just stay cool. And I mean, you probably only need 2 at a time to get back in anyway to put the boat stable. Yeah, calm it. Yeah, definitely better. Less brushing, just like a shower. Yeah. Dog shark.
It's good.
Right, let's do it.
We need to get her very quickly and actually assess how severe the damage is. She could be losing blood. She could have internal injuries. We just don't know.
To find Martha, Chris and keepers Tim and Obi must search the lagoon, home to more than 30 alligators, all capable of killing humans.
See anything through there? You just can't see very far in this water, can you?
Yeah.
When I was on land, I felt pretty comfortable. Out in the water, that's game territory. This is going to be really tricky.
You can see each of them's got their own little territory. Or we stand it up. Defence pose there, so the tail out of the water, the back in the head, just to...
That's not happening.
Well, let's not go near that way.
This has suddenly got much more serious for little Kiko. Initially, I thought it was just a fairly non-specific gastroenteritis, and now she's got actually one of the horrible complications of gastro, which is low protein.
Lisa's hoping a plasma transfusion will stop the puppy's fragile system from shutting down.
Plasma is the clear part of the blood with the red cells taken out, and it's got lots of protein in it, and we give it to her through her IV catheter as a drip, and hopefully that will increase the levels. Because Kiko is so small, she only needs 14 mils of plasma. Most dogs will need a whole bag of it, and I have to just give her such a tiny amount because she's so little. There you go. Got your plasma. We've got so much tubing going on here. Basically, she's getting her fluids with her glucose, and she's having a plasma transfusion. We're not going to really know much until a few hours' time, and I'm really hoping that what we're doing makes a difference.
Electromagnetic radiation from Wi-Fi, your computer, electronics, and just being around other people's negative energy can be exhausting and stressful. We know that stress produces fatigue and leads to lack of focus. So how is this showing up in your life? Do you sometimes feel overwhelmed by your environment or other people? Do you feel anxious? Reclaiming your personal energy starts with understanding your sensitivities. Do you remember what it was like to be bursting with boundless joy and limitless enthusiasm? Take a quiz to learn how to restore your energy and vitality.
Feeling cold? Try hot hair. Simply open the package, and they heat up quickly. Quick, long-lasting warmth. Go get your own. Hot hairs. Bring the heat.
Get out there. Nah, we wish.
That'd be nice if it was,
We
wouldn't it?
wish.
Out on Alligator Lagoon, Chris and keepers Tim and Obi are searching for the badly injured Martha, the 30-year-old by a young male.
There she is. Right there. Sitting on the bottom. Geez, it's a good spot.
She's right there.
Sitting on the bottom, underneath the wall. Pull it tight, pull it tight. Yeah, got it. Let's get her in. You're right, he's up on back, guys. Gotta jump up behind me. 1, 2. Could feel that power in her, even 3 of us on there, and with the head shape, you know, it's a bit of a tug of war, so you don't appreciate how lucky that was. She hasn't got much pressure on her, so just watch out if she kicks.
Yeah. So I've got a big gash there, massive gash there, and you can see the blood coming through it too. And sometimes watch out for gators behind me. Not only has the gator picked on the oldest gator here, but they've also come in from behind and grabbed her pretty much when she wasn't looking and just got their jaws around the back after her. And obviously given her a bit of a shake, a bit of a tear.
Jeez, that's a big gash too. Definitely bites, right?
Yeah, they are. Yeah. She's in pretty bad way.
Hey, little mouse. Do you want a bit of chicken?
A few hours later, and Kiko's plasma transfusion is starting to work.
Somebody loves chicken. Come here. This is exactly what I wanted. It's the most important thing for her to get better is for her to eat and keep it down. So fingers crossed that stays in her tummy.
It will be a slow recovery as Kiko's body heals. Concerned owners Mark and Nicole won't be taking their puppy home tonight.
Hello. You look better. You look better.
Sort of quite unsure of her surroundings.
Yeah, no, she's it's a very scary thing to be here and witness. So I can see it. No flying off tables, huh? You've only broken legs as well.
I just don't think about when I have gastro. So, you hang in there, baby girl.
It's been a roller coaster for this little girl, and sadly, Kiko won't be going home until I'm certain that she's recovered from this. She just needs a little bit more time, and then you'll beat it.
With Mark and Nicole gone, an anti-nausea injection is all too much for the dejected puppy.
I'm sorry. I'm so sorry. Oh my goodness. Oh, you're really gonna hate me.
She's a beautiful old girl.
We're going to wrap it up here, little girl. So much flesh or a bit of skin. That's her. The base of her abdominal cavity there. Jeez. Let's give her a good nudge. First of all, you need to clean it up, make sure there's no chance of infection, and then concentrate on bringing those wound areas together. Because we've got the added complication of the way that she's going to go back under the water, where there are bugs, there are bacteria that can actually get into the wound. Just going to cut a bit of stuff away from here so she might jump. Just watch that. What are you going to do with that? No. It's a totally different beast than dealing with a dog or cat. Its skin is just so thick, you really have to punch through with quite a bit of force.
It's a difficult assignment, and Chris is finding it hard to concentrate with his back turned to 30 curious alligators.
Who's that? Who's that? So does he slip for a sec when they're on the way?
At the Australian Reptile Park, Chris is under siege as he repairs the badly injured alligator Martha.
Occasionally I do get this sense that I'm being looked at. Not in a positive way, but more sort of in a appetising way. And I just know there are eyes behind me right now. I'd almost rather not look and just concentrate on getting done through the care. And then a stitch faster. The 25th and final stitch. It's all done. It's a lot. They look good. You're all right.
A final shot of antibiotics, and Martha is ready to return to the lagoon.
Sorry. It's good. Looks a little sore, but expected. It's the first stitching I've done on an alligator, so it seemed to go okay. We managed to use the needles. But for some reason, we never need to use in Bondi. But pulled them out, dusted them off, and away they went. They did a good job. Straight back to a hidey hole. You won't see her for days.
We don't normally have a day with so many events. I mean, we pretty infrequently get the vet up, so it's been a big day.
Little Kiko has fought a life-threatening case of gastroenteritis and finally won.
She's just turned the corner. She's done a formed stool, which is excellent. There's been no more vomiting. She's been eating really well. And yeah, she's ready to go home. It's great. Look at
Everyone who's going to play with her for the next week is going to get hand rub first. Thanks, guys. Thanks,
been in this a long time, and I've never seen anything like this.
Yeah, no, it's Tedeschi because it's different than all the others. Look at that. You tell me what it is.
There's one last patient to see before Chris heads home.
That is just abnormal, isn't it? You know what it is? With a nose like that's either going to be a platypus or an echidna. Yeah. But it's got to be an echidna. It's an echidna. And it's bizarre, isn't it?
Look, I've never seen anything like it. I didn't know if I was holding an alien when it first came in.
You've got legs, you've got claws, you've got almost a beak there. It's like 4 animals all combined into one weird little skin-covered package. It's just the key to trying to stimulate him into another drink.
The tiny echidna will have to be hand-fed to survive.
My initial response to the vet when you see him is to think, he's not going to make it. But if there's one thing about these baby echidnas, is they're tough. They do somehow find a way just to keep on going.
While the battle is just beginning for the young echidna, 2 months on, and there's good news for Meg. After treatment, her mastitis has cleared up, and she's about to add to the park's koala population.
We took up a treatment just for a short while, and the lump disappeared really quickly. So after that, we've had a really good mating with Herman, so we believe it to be pregnant, and it's ended up all good.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.
She's not actually from Bondi. She's from out of Perth. I am a doctor and I do a health clinic out there every couple of weeks.
GP Catherine Hutt has arrived at the Bondi Clinic with a very unusual patient.
I heard about this premature lamb that was going to get tapped on the head. And apparently she was just very small and had been born in the stockyards and wasn't like disease, of course. Once I heard about her, a very tolerant team stopped off to know anyone from the clinic and picked her up, and here she is. Don't know how many flying sheep there are, but
after 2 weeks in the city, Amelia is struggling.
Poodle cross, is it?
nice try.
Where do you pick up the lamb nappies? I've actually seen the nappy with a hole in the back of the tail.
And they're custom made. They're custom made for every morning.
In aisle 3 at the local supermarket. And the diarrhea she's had. You don't really want to see this. Its technical name for that is scouring. Scout is essentially another word for severe diarrhea. But it's diarrhea with a nasty effect. Dehydration takes away their electrolytes. It means they're not absorbing energy. And scouts, it's probably the number one cause of mortality, of death in young lambs and calves.
Alright, well, we need to fix it.
Yeah, we do. Just ugly abscess here, this side of the body. Now, just like a human baby, the smaller they are, the more fragile they are. They're born premature, and then missed out on
I'll be home.
so she's very alone. I'm going to give her a chalky book just to try and calm down her gut and settle it so she's not producing that
Not loving it.
Chris gives Amelia a vaccination and antibiotics, but he's worried it's only a temporary solution. Samples will be sent to the lab to try and pinpoint what bacteria is causing Amelia's serious infections.
As a doctor, Catherine's done a pretty good job getting Amelia to this point, getting through those tough first few days. But then when you see just how severe those scouts are and how severe those abscesses are, you can see she does need help.
they both become.
Well, being a doctor, you do see some incredibly tough things, but and you think you'd be a bit immune to it and it wouldn't get to you, but she's just got to me. I just love her, and she's just the most special little thing. So I'm a bit worried now.
Any other cats at home? You recently lost his little mate.
Coco, a rescue cat, has just been admitted to the Bondi Referral Hospital Sash.
Hey, Coco. Take a look at you.
Deirdre saved him from death row at a shelter 6 months ago.
I take him for walks on the lead, and everybody stops and wants to pat him, and he's always making friends with kids. They love him.
Lisa suspects anemia and takes a sample to check Coco's red blood cell count.
Oh, the blood looks very watery.
I'm just really worried that it's going to end up badly. Yes.
For Deirdre, this situation is made so much worse because one of her other cats died suddenly only a few months ago.
I don't think I could handle another one dying on me.
Oh dear. It's 8%. 8% is extremely low. I mean, I would expect it in a cat to be in the 30s, and he's got a red count of 8%. So that is not sustainable with life. He needs to have a transfusion tonight.
Until I know that everything's going to be all right. Yeah, and it's nothing underlying. I worry.
3 drops of sample into a new tube.
Coco is suffering from severe anemia, but Lisa has decided to carry out more tests.
Before I give Coco a blood transfusion, I need to rule out 2 other possible culprits. Now, one of them is feline AIDS, and the other one is feline leukemia virus, which is quite rare. Now, both of these diseases can be fatal, so for Deirdre's sake, I really hope the results come back negative. So it's a 10-minute wait now. It's going to feel like a lifetime.
What, Mom?
You said you would help me cut a cantaloupe.
Okay.
Plus, aren't you getting hungry for a snack?
Yeah, sure.
Some hairballs or something like that?
Yeah, let me look at something real quick.
Okay. Wash your hands.
beautiful Coco has cat leukemia, and I almost can't believe it. It is so rare, and there is no treatment.
Sadly, Coco's owner Deirdre was never told there is a vaccination available for cat leukemia. The irony is that Coco still looks so well.
I've got good news for you.
Was never told there is a
Cat leukemia, and I almost can't believe it. It is so rare, and there is no treatment.
Sadly, Coco's owner Deirdre was never told there is a vaccination available for cat leukemia. The irony is that Coco still looks so well.
I've got good news for you, beautiful boy.
Got me flipping pretty, mate.
Coco's a year and a half old. He's a baby. Deirdre's just lost her other cat 6 months ago from perhaps the same thing. It breaks my heart. It always happens to the special ones. Deirdre, I've got some news for you that's not so good. It's an extremely rare disease in Australia, and unfortunately Coco's positive to it. Okay. Alright, well I'll talk to you tomorrow then. Okay, take care. She said to me, I can't believe I've got the prospect of losing 3 cats in 7 months. Our other cat at home is not vaccinated for this, and it's very highly contagious. So she's going to bring him in tomorrow for us to bring her in tomorrow for us to do a test. She's just in shock. Oh. Oh, the puppy dog.
Amelia's test results are back, and her infection's been caused by a bacteria called Pseudomonas. Now, they only get this infection when their immune system's given up the fight. And that's because she never got her mother's milk. She never got those antibodies that were going to protect her for the rest of her life. The fact is, if we don't boost up her immune system, then a nastier bug, a deadly bug, is going to come along and take her out. Sure, we can give her antibiotics now to fix this problem, but long term, we need a permanent solution. And I reckon I've got an idea.
Chris is now on the road to the Golden Ridge Animal Farm to carry out his plan.
We're going to find an adult sheep and actually take some blood from her and take all those antibodies with it and transfer those antibodies from the blood into little Amelia.
It works in foals, it works in calves, and I'll bet you it'll work in lambs as well.
And where are our sheep?
They're up this way, so we'll go for a walk up here and we'll have a look.
Elisa, who looks after the mixed bunch of residents here, is hoping to find Chris a suitable blood donor.
So I guess we need sort of an older one.
Yeah.
Preferably a mother that might even have some antibodies of her own.
Yeah, I've got a couple there with lambs at the moment, so you should be able to find them.
You all want to help, do you?
She's got lambs at the moment.
Yeah, right. It's very kind of you, you know that? It's very good.
Yeah.
This might just look like some sheep's blood, but it means so much more to Amelia. It's full of antibodies which are going to go into Amelia's system and essentially give her a future. Thank you. Oh, Mum. Oh, what's her name?
Barbie.
Barbie. Good old Barbie stepped up, did her bit, and she's the hero. She'll make all the difference.
I've got Barbie's blood safely stored in the back of the nest, but it looks like we've got to make a bit of a detour. The Australian Reptile Parks is called. They've got a critically ill animal. It sounds like it needs urgent attention.
Hi Chris, how are you?
Good, how are you?
Tim will be happy to see you. Come straight through.
He's got a platypus.
He does. It was down this morning. It's unbelievable.
Really? Hi mate, Tim, how are you, buddy? Good, thank you. You never
cease to surprise me. Check this out.
The malnourished platypus was found wandering lost on a suburban road.
He's lucky they didn't run him over thinking he was a rat, you know. Good people. We get some lovely people that bring all sorts of animals in, so this guy's benefited from it.
You got a name for him?
Oh, look, between a few of us, we wanted to call him Ozzy because he's a little battler at the moment. My guess is that he's a young male, he's been kicked out by a territorial male, and he's just trudged through the bush. He's picked up all these ticks, and he turns up in suburbia. There's 20, 30 right there.
My worry is that he's got 40 or so ticks in that container. He's probably got another, at least 40 on him there.
Yeah.
Each of those has, say, half a mil of blood, even a quarter of a mil. That's 10 mils of blood. He's got to be severely anemic as it is. Underweight, dehydrated. He's got a lot of things going against him. What I might do, just to, I guess, it's a bit of insurance against him going into shock himself and not really handling his whole experience, actually give him some fluids now. That should help his blood pressure straight away. Has he tried to use his spurs yet?
No, I mean, they're still there.
Yeah.
And they're quite large still for a young plat, but
Jeez, they are decent. As the minutes tick by, he's becoming more and more stressed by the whole situation. So we've got to get the ticks off quickly. They'll pay a lot of
Get out me flipping party, mate.
I and most of the guys here would rather cop a whack from the king bringer than one of these, you know. The pain is just said to be unbelievable.
It's amazing. Everyone just assumes that it's so cute and cuddly.
Yeah.
And they're
I'm
cute.
good, dude.
Gosh, it's nasty. Look at the surprise waiting for you.
Chris continues the painstaking job of removing all the ticks from Ozzy.
So when you
I'm
open
good,
up
bro.
these, you realise just how many there are. It's like having open wounds all over his body. The fact is, he can quite easily die from these ticks because each one of them is taking just a little bit of blood, and that could be enough to kill him.
Don't get out, there's a big coffee dog around there. See? She's not as forthcoming as Coco.
Deirdre has brought in Coco's sister. She's desperately hoping Chantal has been lucky and not caught the deadly leukemia virus from her brother.
I'm not gonna get really, really worried until I find out there's something wrong with her. That'll be it. I don't think I'll be able to have more pets. Yeah, I think that'll be it. That'll do it. I like your children.
I'm going to take Chantal on the back and get some blood from her. Good girl, Chantal. I think there's quite a high chance that Chantal's going to be positive for feline leukemia virus just because she's in such close contact with Coco, who's got the disease. There's still a chance that she hasn't, so that's what I'm hoping for.
In 10 minutes, Deirdre will know Chantal's future.
No, wait.
Jeez. It's important to realise that these aren't paralysis ticks. There is more than one type of tick, and these are actually called bush ticks. So what they do is they just suck blood. On a small animal, finding one or two ticks is a concern. Finding 100 is extraordinary and extraordinarily worrying too.
After a thorough examination of Ozzy, Chris is satisfied he's removed all the ticks from the orphaned platypus. A preventative spray should now stop any other ticks ravaging his fragile system.
Listen to that. They don't very often make a noise.
No. That's almost the emergency beacon for them. They make that sound when they're really stressed. His natural environment is water. He's going to eat when he's in water, so the sooner we can get him there and get him relaxing, the better.
Alright, it doesn't look real good there, so I want to get him in nice and quick. Just going to ease him down a bit. I think I might let him see where he is. We'll just keep him isolated for the moment, you know, give him his own little tank, and let him try and recuperate until he gets healthy.
Looks good. He's hungry, isn't he?
Yeah, actually eating mealworms. Look at that.
Look at the sonar if he's still working then.
There we go, another one. That's a good food response. I mean, that's immediate.
It's not over by a long way. You know, for him to be like that in my hands, then touch the water, it doesn't mean we're in the clear, you know. That's sort of his last-ditched attempt to get some nutrition in, you know, but we've got a long way to go. You know, a lot of it's up to him. All we can provide is food, shelter, water. You know, we can put all the elements there. He's got to have a good will to live.
I just hate waiting for this. Another minute to go. So far it is negative, so it's just great. It's negative. I am just so happy and relieved. I mean, I was trying to stay positive, but the odds of Chantel getting feline leukemia as well was so high. And now finally I can give Deirdre some good news. I'm so excited. I'm just going to go tell her right now.
You're smiling.
I'm smiling. It's good. Negative.
Very cool.
So,
So now what do we do with Coco?
Coco is still infectious, so if Deirdre wants to take him home, he'll have to be quarantined away from Chantel.
I don't know what the right thing for you to do is, whether you should take him home or whether you should leave him here. Medically, it's safer for him to be here, but emotionally, it's better for him to be at home.
Yeah, maybe if it's only for a couple of days. Yeah,
Okay.
spend a few days with him.
I think that's lovely.
It's just going to be hard getting to separate. Yeah.
But I guess it's something you've got to do if you want to have Chantel around.
Yeah.
Maybe you just enjoy him and call me if you have any problems at all.
Oh, look.
Okay. I don't think this was a tough decision for Deirdre. I think she knew straight away that all she wanted was to have her. Bye, gorgeous boy. Even if it's only for a limited time.
I'll take him home and give him cuddles and nothing.
So now Barbie's blood's actually settled, and you can see what I'm after. It's this clear golden fluid that's sitting on the top. That is full of proteins and full of antibodies. It's called plasma, and that's what needs to go from here into little Amelia.
Catherine rescued the orphaned Amelia from outback New South Wales, but the tiny lamb is now under siege from life-threatening infections.
You sound like Amelia. Oh, hello, Amelia, you've grown.
Oh, Chris, how are you? Come here.
Good to see you. Hey, Amelia. Okay. Here we are. I'll give this over a course of about 5 or 10 minutes, just to minimise any risk of this really protein-rich, antibody-rich fluid overwhelming your system and really sending you into a bit of a shock state.
Well, I think it's a pretty amazing idea. If it works, fantastic. Anything that's going to help her. She's not quite 3 weeks old yet, so there's still a way to go before I'm confident that she's going to be all right on her own.
Amelia, we're done.
So how are we going to know if it works?
It's almost a case of no news is good news. I mean, if she doesn't get any infections, then you know it's working.
And here he is, our little Aussie battler. He's beaten all the odds. He had 80 blood-sucking ticks on him. He was on the road and avoided getting hit by a car. He walked all that way through the bush. And I tell you, if this bloke was human, he'd be selling his story to a magazine.
Ozzy, the great survivor, has made a full recovery and is adapting well to his new home at the Australian Reptile Park.
Now, as for his future, in captivity, he's going to become very dependent upon us. So he might finish his days in a breeding program as an ambassador for his species.
Girl in a hurry, aren't you?
With the transfusion administered, Catherine's now trying to negotiate as much time as she can with Amelia.
The plan now is to continue feeding her milk, but her focus really has to shift from milk to grass at some stage.
Yeah, we're supposed to be eating grass. I think she prefers carpet.
I think we're probably looking at about 6 weeks from now that we can start to think about moving her away onto a farm.
I don't know who's going to be worse off, her or me, because I don't know how I'm going to cope.
Catherine might say 6 years, but 6 weeks is probably going to be about right.
I think
we could stretch that a little.
What? Hi, I'm Dr. Danny Busek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them,
It's the Effie Holiday Sale at Macy's. Save 30 to 55% on the Effie Fine Jewelry Collection. Take 40% off gemstone settings. And save 35% on the Trio Collection. Plus shop supervised like diamond rings for $1,499 each at Macy's. Hills always starts with a pet's biology to anticipate their ever-changing nutritional needs. Where differences you can see, feel, and trust. So you're always a step ahead.
Make my world a better place.
Yes! You're walking with me.
Jimmy, g'day. How are you? Good, thanks, mate. Mate, for a school bag, of course you've got a school bag. I'm guessing what's in there isn't for kids, though.
Nah, we've got a treat for you today. Tim Faulkner from the Australian Reptile Park has made a dash to the Bondi Clinic with a very special 6-month-old patient.
And there he is. Lewis is in a bit of strife.
Along for the ride is Lewis's twin sister, Luna.
So, did you see what happened, or do you know what happened to him?
Basically, they got up to a bit of mischief just running around, and Lewis comes back, and his leg is, visibly sore. And
It could be a bite, it could be a fall, it could be some sort of injury through play.
yeah, they're definitely playing. Like, it hasn't stopped him. He's still nuts.
Mate, can you tell us what happened? Until the end? Lewis will get a bit out of control with that. No? I hate to say it, it's like you can't second best. It's a small one big yawn, is it?
First, Chris needs to remove Tim's amateur handiwork.
He stuck it on. First one I put on, he just tore it off, ripped it straight off. So, try and move this leg as little as possible, but he's just making little grunting sounds. Yeah, they give so little away. But the little grunting sound he's making, it's bothering him. Yeah. Lewis right now is whimpering from time to time. He's really guarding that leg. He's trying to hide it from me. So if it's worrying him, then it's really worrying me.
An X-ray will tell Chris just how serious the injury is.
Oh, don't do that.
But Lewis is not planning to make it easy.
But it's for comfort, right?
It's just security.
Yeah, security.
They bite on demand that way.
Your mum.
Yeah.
Oh.
Hi, Gypsy. Hi, honey.
At the Bondi Referral Hospital SASH, emergency vet Lisa Chimes has been given a difficult case.
What's wrong, Gypsy?
6-month-old Gypsy has been brought in after struggling to keep any food down for weeks.
Why'd you go for a walk?
this poor dog is absolutely terrified.
Gypsy, Gypsy.
I just don't know how we're going to find out what this dog's problem is.
Why don't you come on, Dad, out of the cage? Come on, sweetie pie.
A story just waiting to be told. We're the ones to write the future.
Good girl. Hunter. I know. What about this?
I been told that she's regurgitating, but without actually seeing her do it, I don't know how we're going to diagnose this properly.
You're only a puppy. You shouldn't be like this as a puppy, Barb. What's happened to you?
She should be jumping all over me, wanting cuddles, being energetic and wanting food, and she's just cowering in the corner. So I'm worried that this dog's had something seriously traumatic in her past or lack of socialisation. Something's going on to make a 6-month-old puppy behave like this.
Hey there. Lisa has now called in specialist Justin Wimpole to do further tests.
Poor girl's very nervous, aren't you? So, we'll try some liquid, see how we go. Bit touch and go, I think, still. We'll try to go slow with her.
So the test we're doing on Gypsy is actually like a live x-ray. So when she actually swallows, you'll see the food going down. And what we're hoping to find is the area where that food is getting stuck.
No, it's just not the matter. What about a bowl of food? Come on, Gypsy. Come on.
Justin's had no luck. The fluoroscopy, this test we're trying to do is an absolute failure. Hi, Gypsy. Hey, honey. We haven't got a diagnosis. We don't know what's going on with Gypsy. We have to move on to the next thing, which is a CT scan and endoscopy under anaesthetic. I'm just trying to help. She doesn't quite get it that we're trying to help.
This is normal.
This means he likes you. He's just feeling safe.
Lewis, the 6-month-old Tasmanian devil, is about to have his injured leg x-rayed. The youngster has become quite attached to Chris.
I've never heard a grown man make that sound.
Dog, alright?
Fortunately, those baby teeth are not doing too much damage just yet.
Pop.
He's being good, he's not struggling. X-ray. But I can see this straight away, mate. It's not quite new. He does actually have a fracture there. If we do nothing about it, then it's really going to limit his life. Yeah. And he just wouldn't be able to breathe, wouldn't be able to get around, wouldn't be able to survive. Yeah. I'm a little bit in awe of him, how much he's been able to get around and put up with that. Yeah.
I cringed when I saw the x-ray and I think, what spirit these little devils have got.
No, Lewis. Huh? Broken leg, buddy. Not to say it. How are you going to fix it, though? Managing Lewis's leg, I can really see two big challenges here. First of all, he's growing, so we can't use a cast that's just going to lock that leg in position for months. That won't work. But secondly, he's a Tassie devil. He bites and he chews. He will tear off anything I put near that leg. This isn't going to be easy. I've done that exact injury. Same leg, same bone. Do you know how to do it?
Yeah, tell me.
On a dance floor.
Boogie moves.
Yeah.
Oh, no. What move?
A running inverted worm. Landed and cracked the bone there.
Maybe that's what Lewis did.
Maybe. Want to come clean with us? I'm showing off to your sister. I can't use a cast in this leg for the simple fact that even if it's on for 4 weeks, 6 weeks, his leg will probably go a full centimetre in that time. If there's a cast over that bone, the bone won't grow. So he'll have one leg shorter than the other. What we need to do is give him some sort of splint that is strong enough to stop that bone from moving, but still flexible enough that the bone can grow within it.
Amazing, couldn't he?
He's been incredible. This advice I know you won't listen to, but I'm going to give it to you anyway. Just go easy. Take life slowly. Let's not panic. Let's just enjoy our youth in the slow lane. Just for a few weeks. Is that okay? It'll make a big difference. What we really need from him is essentially the impossible, for him to stay quiet. Yeah. This bandage will mean that he really stays off the leg a lot, but he's still going to try to push his limits because that's what devils do.
Yeah.
4 weeks maybe, because he's so young, could be enough.
Just got to stay off it.
Yeah. For most pets that I've seen here, if their leg isn't 100%, it doesn't really matter. They can get around, even if they have a slight limp. For a Tassie Devil like Lewis, his leg needs to be 100% because in the future, he's going to go and essentially live in the wild. He has to survive there, but also he has to breed there. On 3 legs, he just can't do that. I'm just impressed that 2 Tassie Devils visited here, and the only person that really got a bite was me.
Yeah.
No dogs injured, no cats, no nurses.
Yeah.
No one was harmed in the filming of this segment, apart from me.
Gypsy. Gypsy. It's only food, sweetheart.
At Sash, Lisa's trying one last time to persuade the terrified Gypsy to eat.
Come on, Gypsy.
The 6-month-old shepherd finds it impossible to keep food down.
It's okay, honey. It's alright. It's okay.
Gypsy's owners, Roy and Hazel, have now been called in to help.
It's okay, honey. You're okay.
Gypsy was Roy's surprise 70th birthday present after their previous shepherd passed away.
This was very, very loyal, and when we found out about this, I thought that we don't have it on.
Yes, I think that's the worry. That they'll find something really horrible and untreatable or something like that. I think that's the big worry.
I'm Leah, and that's me. Long before I had moderate to severe rheumatoid arthritis, I've always been the ringleader, had a zest for life. Flash forward, then RA kept me from the important things.
See what she does.
Gypsy, what's this? I'm hearing about you. No, see that?
If Roy and Hazel can't get Gypsy to eat, the puppy will be forced to undergo invasive tests.
I can't believe she's eating. Oh, we tried very hard to get her to eat.
But within minutes of eating, Gypsy is becoming visibly distressed.
Oh, she's really looking agitated now. Oh, she's feeling sick. Just regurgitated. Poor thing. This poor dog has really just been living with this chronic battle her whole life, and no wonder why she doesn't want to be touched. She's got constant heartburn, and that must be agony.
Gypsy now needs a CT scan, but Lisa decides to send her home. The puppy is just too nervous to stay in hospital.
Well, we're a bit like people with kids having tests, who, a bit anxious about what they'll find out and so forth. So, I'll be glad when it's over.
Hey guys, how are you?
Next day, Chris arrives at Coffs Harbour in northern New South Wales to pay a house call to one of his most lovable patients.
Now, Bucky's a bit of an old time, and the staff here are pretty concerned, so it's time for a checkup.
3 years ago, 42-year-old Bucky just survived throat cancer. Now his longtime trainer and best mate Greg is worried the cancer has returned, this time in his mouth.
3 years ago, when Bucky's cancer was first diagnosed, it was a treatment that nearly killed him, and Greg was convinced he was going to lose it. What are you saying about me, Greg?
Chris, hey.
How are you? Good to see you. Hey, Buck.
It's been a while.
Hey, buddy.
Just good to see you.
How you doing? Hello. Hi.
It is frightening what could happen, if it turns out to be cancer.
All right, Buck. You're the jealous type, are you, Greg? Come on, Buck. Here you come. Here you go, buddy. Hey. How's that? Bucky was just 6 months old when he was found on a sandbank, badly lacerated, sunburned, and he was brought in here and nursed back to good health by a 19-year-old Greg. They've been together for 42 years. Greg doesn't use the word love, but That's exactly what it is.
It was really hit me hard when we discovered that was cancer in Buck's mouth. While I was there for him to support him and give him the encouragement to fight on. Without that there, I don't think he would have made it.
I can see what you mean. Just in the front of his tongue and just underneath his tongue, he's got a few little lumps. Yeah. So I guess the hope would be that those lumps are just from fish, these little spikes in the fish have gone in there and caused a little infection. But obviously the concern is him having cancer a few years ago that maybe something's come back.
Yeah. He's like a brother and sometimes even like a son. That's a strong bond, a close bond. He's a real fighter.
He's been through a lot in his life, hasn't he?
He has.
The average life expectancy for a dolphin is about 20 years. At 42, Bucky is already a special survivor. Blood tests and biopsies will confirm whether Bucky faces another huge challenge.
When you consider that 3 years ago, they nearly lost Bucky to cancer. For me to come back here today with the concern that the cancer's return, you can understand why it's a really nervous time for everyone here.
Hello.
Hi, Tim.
Six-month-old Gypsy is back at Sash, and she's not impressed.
Okay, Chips. She's not happy to be here.
No. Gypsy's so anxious in this hospital. She's scared of vets. She's scared of anyone except her parents.
All right, Chips. We'll look after you, sweetie pie.
Okay.
Lisa's hoping to find out today why the puppy can't keep her food down and is in constant pain.
Gypsy, come. That's the way.
Okay, bye-bye. I really feel for Roy and Hazel. They're so distressed and anxious. They've had Gypsy since she was a young puppy.
Yeah, I feel like our mum at preschool. I do love her a lot.
The investigation starts with a CT scan,
Very suspicious.
but it's inconclusive.
We've had a really good look at the CT, and as it gets lower down towards the heart, there's some definite narrowing. So obviously something is making that area a lot more narrow, and that's where the food is getting stuck.
The team needs more information. A camera is now being put down Gypsy's mouth through her food pipe. What they're looking for are abnormalities inside the esophagus.
There we go. So you can see there's a severe narrowing here in her esophagus.
That's really narrow.
Yeah, so we can get through with our little scope, but you can imagine a whole lot of dog food just can't get through there, causing her a lot of distress and making her regurgitate.
And imagine with all that saliva just sitting there, she's probably got constant heartburn. No wonder she doesn't want to be touched. Gypsy has a condition called a persistent right aortic arch. Now, it sounds all fancy, but basically it means that Gypsy's got an extra vessel in her chest near her heart that is constricting her esophagus, her food pipe.
Gypsy now requires urgent surgery to open up her food pipe. Her regurgitation problem has already caused her to be underweight, and there could be far more drastic repercussions.
They could inhale some of that material that comes up. It could cause them to choke in their throat, or worst case scenario, they could cause a terrible infection in their lungs, and then she's dealing with pneumonia as well. So it's something we really have to fix.
It's the Effie Holiday Sale at Macy's. Save 30 to 55% on the Effie Fine Jewelry Collection. Take 40% off gemstone settings. And save 35% on the Trio Collection. Plus shop supervise like diamond rings for $1,499 each at Macy's.
So, you're the new Hartfield patient.
How do you know that?
Well, I heard about that little stunt you pulled.
Is this about the pudding?
Not everything's about pudding. I'm talking about your greatest book.
Oh!
Yeah. Once you know what has to happen today, I'm not
so sure you'll be so keen on these kisses.
At the Pet Porpoise Pool in Coffs Harbour, Chris is about to find out whether 42-year-old Bucky has been struck down with cancer for the second time.
No, it's serious. It's serious work. And you're doing your best to make it less serious, I know, but... don't try this. Bucky.
A bit nervous. I'm staying positive. There's not going to be anything, but you never know.
How's he doing with the shows? I mean, he's getting on in years.
Yeah, he's getting on, but he's not showing any signs of slowing down. He's a really strong animal, and the excitement of the crowd, spurs him on.
This was Bucky in action only 2 hours ago, doing what he loves most.
He likes to be the centre of attention, like any star.
The type of cancer that Bucky had was a squamous cell carcinoma.
Hey, Bucko, you ready for this, old mate?
They're renowned for being very tricky to remove entirely. It looked like the job had been done incredibly well and hadn't shown any signs of recurrence. But recently, these lumps have appeared. Everyone's justifiably concerned. So what I guess I need is just for him to have his mouth open as wide as we can for as long as we can.
Yeah, we can manage it, can't we, Buck? So we'll just give it a go first. Open wide, Buck.
Yeah, see, that's just too rough there for my liking. And it's normal for them to have little undulations in this area around the base of the tongue, but that one's just a little bit raised there.
Yeah.
In amongst the rough patches are some little nodules, and they're really what worries me right now, because they just shouldn't be as raised as they are. I'm not saying it is the return of the cancer for sure, but there's enough evidence there to say that we should be worried.
Yeah.
So I really do think we need to take some samples.
I was hoping Chris was going to say it was nothing, but it's even a little bit more worrying now.
Gypsy's going to have surgery. The surgery would be open chest surgery, so that's the part of the esophagus where the narrowing is, so they will have to open up her chest, have a look in there. Then she'll have to stay in hospital for quite a few days after that to recover.
So it's just usually they'll give you hospital on blood Gypsy, and then probably that's just like this, and put up her too. A lot of people know strong.
The surgery is big and it's risky and it's painful, it's chest surgery, but the benefit that she might go on and be able to eat like a normal dog certainly outweighs all of that.
I need a hug.
You need a hug? You'll look after her, I promise you. It's going to be a long night, but we will, we will give her all the love in the world. They are so nervous. There's some big things ahead, and hopefully we can get it through this.
At Coffs Harbour, Chris is continuing his investigation into the disturbing lumps in Bucky's mouth.
Still back. So the first thing I need to do for Bucky is take a biopsy of one of those lumps, send it away to a lab to be analysed and check if it is cancer. Okay, yeah, got it.
Yeah, we'll sort things out for you, Bucko. Yeah, I'll find out what's going on. Hey, you'll be right, mate. You'll be right. I'm with you, buddy.
The relationship between Greg and Bucky is pretty extraordinary when you realise that it's been going for 42 years. A marriage would be
I'm going to go pick up the flavorings for your water. Drink on your water.
for that long. Friendships don't last for that long. It is just off the charts.
You're right, mate.
So the cells that are on this slide should really be able to tell us if Bucky's cancer's returned. And
Send this off to the lab straight away. Just tell them it's urgent. Hang on, just be right. Good. Thanks, mate. Cheers.
I'm not going anywhere. I'm staying here, alright, honey?
At Sash, Gypsy is about to have her chest surgery.
Even though Gypsy's had some sedation, she's still really, really nervous. You can just see the look in this dog's eye. She's just terrified. So I'm going to stay in the room until she's under anaesthetic, just so that she's got a familiar face.
Specialist surgeon Andrew Marchevsky will attempt to fix the rare condition she has been suffering from since birth.
Gypsy's got persistent right aortic arch, which is a congenital abnormality that basically ends up with a narrowing of her esophagus, and as a result, when they try and swallow food, it just comes straight back up. If she keeps doing that for the rest of her life, eventually she's going to end up with pneumonia, and that can be catastrophic, and they can fail to bleeding is always a potential problem in the thorax. There's lots of big blood vessels because you're under it. You just got to be really careful. That's the actual band of tissue there that we're going to be cutting out. So you just want to cut one side like that, and grab the other side. And now you can see that band as well. And then as soon as we've cut that, you can just see the esophagus expand.
I promised Hazel and Maria that I would be there every step of the way. How's it going?
You're interesting.
Yeah.
You can see some things we get out. I want to see it.
It's going to be a long recovery process. Gypsy's had big surgery. Doing really well, sweetie. Good sleep. We're just going to have to wait and see how she goes day by day, one step at a time.
Wellness always starts with a pet's biology to anticipate their ever-changing nutritional needs, with differences you can see, feel, and trust. So you're always a step ahead.
It's time for Kia's Holiday Sticker Sales Event. All of our amazing vehicles come with a 10-year 100,000 mile warranty and advanced technology features. Enjoy the
To the marshal like your fire.
66 months and 2,000 additional cash on specially taxed 2019 vehicles. Visit your local Kia dealer, look for a sticker, and save. It's the perfect time of year to get a great deal, so hurry into Kia's Holiday Sticker Sales Event today.
These episodes, check out his info. Just sitting in this area here. Okay? If it's a normal size, then we can be more confident that they have cancer. There's something else that's going on. What's wrong with you? Yeah, no, it doesn't matter. At the Pet Purpose Pool, Chris is now performing an ultrasound on one of her major stars, 42-year-old Bucky. How's this going? What's wrong? The dolphin survived throat cancer 2 years ago, but now new lumps have been found in his mouth.
If this cancer was going to spread anyway, we expect to start getting time. So this is a really crucial part. I work on what's going on with Bucky. Okay, yeah, we've got him now. We've got lymph nodes enlarged, so it's a bad sign. The cancer may have spread. Alright, so we've got this little band-shaped area here. That's our lymph node. Just want some measurements here. It's a bird. Just want to look at this. It's 28 millimeters by 80 millimeters. For him, that's really. Oh, that's bad, yeah. That's bad. So, obviously, we still have to find out if he does actually have little things inside his mouth. But even if he does, I'm pretty confident that they haven't spread. So, that's a good result. What's that news about this?
You happy? You're happy? I'm starting positive. You're not going to go anything, but you never know.
I still have to take some blood though. Don't know handy though you have in here to see how old he is.
Yeah.
He's It's going to use this upper aspect of the tile just to run this white line here. Big second blood from the dog. Until blood from the dog, you got the jugular, you got the teeth right there. Here, he's just sitting right here. Amazing blood. This is what it shows his age anyway, isn't it?
Most likely.
All right, we're done.
The bloods will now be sent to the lab for urgent analysis. All Bucky's results will be back within 24 hours.
Well, we'll just keep our fingers crossed that everything pertains to Bucky did.
Bucky, unfortunately, good news for you tomorrow. I'm hoping. I'm going to fall asleep. It is going to be a really tough night tonight. Obviously, I'm hoping for the best, but preparing yourself for the worst. And if it is bad news, if it is cancer, then I need to plan on getting into action much straight away. Feel good. Feel good. Bucky's results come through.
Yes. Next morning at the pet purpose pool, Bucky is enjoying some R&R, while his longtime friend and trainer Greg is working with Daisy, the sea lion.
Thank you.
The results of Bucky's tests have been fast-tracked.
Yeah, it's not really what we're hoping for. We got Bucky's results back. No, it's not good. So it has gone back as being cancer. So it's saying it's a squamous cell carcinoma. So it's the same thing as before. It's a recurrence of it. So
Doesn't sound good. Australia which turned out to be nothing serious. But, wasn't the results I was hoping for. But it is what it is. You've got to accept that and deal with it. Best way we can.
you're right.
I'm a bit shocked. I wasn't expecting it.
It's only very good. It's a very hard thing to do. You know the history between them. You know those 30-odd years of connection they have. So you're telling him essentially his best mate is seriously ill. It's not nice. At his age, I'm just not confident he'll get through another operation or get through chemo. So I'll come up with something I think will work, but also something that's not going to be too trying on him. The priority of Bucky's treatment really has to be that he stays happy and healthy. So the treatment I have in mind, it's going to be short, it's going to be sharp, it's going to be to the point, but importantly, what I have in mind should kill off this cancer pretty quickly.
So what's in it? Listen, mate, there's one. It's not good. It's not good. We've been through this before with Buck, and he's strong. I'll stand by him and give him all the support I can.
No drop here, one.
Yeah, okay.
Right, so this is what we're going to use. So there's liquid nitrogen in here. I just need him, just as he was before, just his mouth nice and wide open and still. That's the most important thing.
Okay. Impatient. Impatient. He's ready to go.
What we're going to do is use cryotherapy. So essentially we're going to be freezing these lumps off. So you can see how the lumps turn white. The reason for that is that all our cells are frozen. We're waiting for them to defrost. You can over and over again 3 or 4 times. Then you have a chance of really killing off that cancerous tissue. Can you get that?
No one owns the sun. It's a reminder each morning that nature works. The glow and goodness are there for everyone. So grab it and start every day with Palms of Mind. Made from the best ingredients under the sun.
good, real eye-opening. Because although you can't own a sunrise, you can make a choice.
I am gonna go and get your mum and dad. What do you think? What do you think of that now? You want to see mum and dad? Yes, I do.
It's been 24 hours since Gypsy's chest surgery. Today, her neighbours Hazel and Roy will find out if the operation has worked.
Hello. Good. How are you? You ready?
Yes.
I'm not getting too excited, but I know she will.
Gypsy, hello,
Gypsy. Hang on, Gypsy, sweetie. I'll open it in 1 sec. I just don't want her to get too excited because she's had chest surgery. And as soon as she sees them, she's just wanting to jump all over them and trying to keep her calm. But the poor little girl is so excited to see mum and dad. I'll stand here. Too much excitement. It's not dry food just yet. It's a little bit more solid than liquid, so we'll transition it very slowly, but this will be a really good test. See how she looks.
Will Gypsy finally be able to eat a meal without pain?
Last time she would have already brought it up by now.
Yeah, absolutely. She would have been in rapid distress by now anyway.
So how does that make you feel?
Very, very, very upset.
And she's smiling. She's just like a different dog. I can't even describe the progress that we've had. This is one of the most exciting things I've seen. I saw how hard it was for this little girl to eat, and now she can eat like a normal dog, and that was just massive.
Impacts later, Jess is trying to freeze up cancerous tissues in Becky's mouth. Look at that.
A little bit longer now. A little bit longer.
Hopefully, this treatment will give the deteriorated patient a new release of mind.
That treatment's gone really well, and it's gone really well for one person, and that is that Bucky stays so incredibly still. Thank you both. Thank you. Amazing. It was really good. Very, very good.
And he's one of a kind. There's nothing about it. He's a really unique elephant. He's got so much fuss and so much to do with. He really knows his words sometimes.
Defense and the cancer treatment always. I don't want to be the person that came in here today and told Rob this bond, this partnership of 42 years was coming to an end. But after seeing Bucky's response to his team, I have no doubt he'll be showing off for a lot of years to come. You're welcome. You're welcome. I said it. Anytime.
That's Sash. It's been 3 days since Gypsy's risky surgery. Roy and Hazel had almost given up hope of their little girl having a normal life.
Gypsy was jumping all over Hazel and then jumping on Roy and then back to Hazel and Roy, and she just didn't know where she wanted to be, but she just knew she feels good and she feels happy and life is great. And you know what? Did I get a big hug for you? I got such a warm hug from Roy and Hazel. The first time they ever hugged
Look at that leg. How good is your leg? You're running.
Dude, what the flip? Resetted it, but okay.
The cast came off a week ago, and from the moment it came off, he was strong. His leg has shown no signs of tenderness or anything. He's using it like a normal devil. He's running, jumping, fighting with his sister, everything we could have hoped for. That leg looks good, buddy. That leg looks good. Your sister won't be able to bash you anymore, mate. Your legs are better. You're all strong again. Thank you. Chris is back in person to check on Bucky's progress since his cancer treatment.
Now, Bucky would like to say a lovely big thank you to Dr. Chris.
What is that? What is it?
A big kiss.
Wow, you're really lingering. I never thought I'd say that I'd come home from Coffs Harbour with, to be honest, patch rash.
You've got both a big round of applause. Oh, great kick. Bucky's underneath it. What a take from Bucky. No video rest. Now we're going to forward it up to Zip. Okay, Zip's
To see him come out and perform and put on what was an extraordinary show. It's amazing. He's such a trooper. He's got such a strong spirit and such a desire to make people happy. He and Greg have got a lot of happy years ahead, I'm sure of it.
We keep working together and keep that strong bond and that strong relationship going. Build it here together for a long while yet.
Hi, I'm Dr. Danny Busek from Bondi Tech. If you love our show and want to see more, plus
Hello, Chris speaking. Yeah. What? How do you get stuck in the slot there? Yeah. I can get there. Can you just text me the address? That'd be great. Alright, thank you. I'll see you soon. Bye. So, rescue pelicans, penguins, ducks, all sorts of things. Never had to go and rescue a black swan in the middle of suburbia. Quite strange, but there you go.
Chris has been called out to a northern Sydney suburb for a wildlife emergency.
Hey, Chris, how are you?
Shelley,
Yeah. Thanks so much for coming. Yeah, we're just a bit worried. We've got this swan that came into our back garden this morning. So the kids were really excited because they obviously wanted to pack swan, but we realised that there was something really wrong with it because it couldn't really move very well. The whole thing actually got himself caught in the socket net and got his whole head and neck caught through one of the squares. We could actually pick him up. We actually was cuddling him this morning because he was so scared. And
Shelley and the family have done a great job in rescuing the swan, but my worry right now is what happened when he was stuck in that socket net. He could have so easily damaged his neck or his wings. I want to tell them right now, but the moment they get close, it's really clear just how distressed he is. He's quite weak. He shouldn't really just let me do that.
yeah, I'll get you back. Yeah, sure.
He wants to get rid of me and leave himself there to rest, but we have to check him out and work out why he's walked into this backyard in the first place, but then why he just can't fly away.
Just really worries me that the fight goes out of him so quick.
Yeah.
The swan's condition is deteriorating fast. Chris is worried the bird is running out of time.
His heart rate's quite slow.
Yeah.
He's not in a good way. He's incredibly weak and just really struggling to even just to keep himself standing there.
At the Bondi Referral Hospital SASH, 2-year-old Stanley is finding his own back. The British Bulldog is struggling to breathe.
Just feel like he's in pain the whole time.
Worried owner Michael is trying his best to keep the Bulldog calm.
Maybe he's around other dogs or gets really hot. He can't breathe properly. His throat swells up. I can't walk more than 5 meters. And that just starts. And it's just, you feel bad for him when you've got to take him home.
Michael, is it?
Yeah, it is.
Andrew Marcheski, how are you?
Stanley.
You sound like a diesel. That's the loudest snore that I think I've heard now of a bulldog. That's pretty bad.
So he's 2 years old. How long has he sounded like this? Over a year, yeah.
If you don't do something before the next summer, he'll win a whole heap of trouble.
No, the soft palate. It's like a flap over the back. Yeah, a little dangy bit. But theirs is, in dogs, it's much more broad. And in these guys, it's really broad, really thick, and really long. If you don't do something now, his whole voice box will just end up collapsing. Yeah. And if it gets to that point, the only thing we can do is put permanent tracheostomy in. Tracheostomy is a hole in here, and that's, you can do it, but it's really high maintenance, and they don't get a normal quality of life out of it.
Michael knows that if something isn't done soon, he risks losing his buddy.
He's just going to overheat and pass away. And that's generally what can happen.
Hello, Australian Reptile Park.
My name's Jodie. I'm wondering if you can help me. We've got a funnel in our house. I'm home alone with the kids. So I'm not sure if you can come out.
Yeah. I sure will. But don't go near it. If you can keep an eye on it from a distance, that'd be good. I'll be there as soon as I can.
Okay, thanks.
Bye.
Australian Reptile Park Operations Manager Tim Faulkner is on his way to help a family under siege from a funnel web, Australia's deadliest spider.
Hello? Funnel web rescue?
Oh, Tim, that was quick.
Hello?
Hello, I'm Jodie. Nice to meet you.
Yeah, you too. How are you?
Good, thank you. Well, not really. We've got a funnel web in the house.
Funnel webs kill, and people know that. So it's a little bit terrifying when you've got one in your backyard, let alone in your house.
Tony, did you see where it went?
I think it went under the fridge or behind the CD rack.
I don't know how long the spider's been here. Look, I've got goosebumps. It's quite scary, actually.
What did it look like?
It was big and black.
You're pretty brave in here. I've actually got your feet up.
I'm up now.
You're up. I'm going to have a look.
I've got the heebie-jeebies.
Jodie knows firsthand how dangerous these spiders can be.
My husband stomped on one and killed it. And it actually didn't bite him at all, but within an hour he was sweating and he was green. And, it just gives me the goosebumps because he was so unwell.
There's one part there I can't see behind.
Be careful.
I was worried he might have hurt his neck in the soccer net.
Back in Sydney's north, Chris's concerns about the swan's survival are growing.
He's just got some discoloration in his mouth there, so that'll happen when he's weakened. So his own immune system isn't able to clear out the gunk in his mouth, and he's more prone to infection. He's also just got a little bit of discharge coming out of his nose, so fluid coming out of his nostrils. He's got some bugs running through his feathers too, so they only really take hold when they are weakened. So this is something he's been battling for a while now.
Yeah.
This one looks like he's close to death. But the decision he made to stumble to Shelley's backyard, it was a last resort. But hopefully, it saved his life. Look, I'm quite worried about him. He's actually in an incredibly bad state. For him to sit like that is a real worry. So I don't even want to wait till I get back to the clinic to treat him. I want to actually start now.
Yeah.
He doesn't even look like he's got much time, to be honest.
At Sash, Stanley is in serious trouble. The British Bulldog is fighting for oxygen.
Oh, mate. Gets worse and worse. It gets worse and worse. Oh, yeah. Every breath he takes, he's having to breathe that little bit harder. It creates a lot of negative pressure. And with too much negative pressure, their whole voice box can start collapsing. And there's no point in me trying to look down his throat because he'll just get distressed, I tell you.
What? You just came in here to just stare at me?
Mm-hmm.
To anesthetize him. Have a look, make the assessment, and say, okay, I've got to do this, and just do it.
I think that's the best option.
I don't think he'll see this. I don't think he'll see the summer through.
That was what we were worried about.
Yeah, have a look. No, there you go. I should have. Yeah, go. It's too exciting, mate. Really? You're quiet when he sneezes.
Andrew wants to operate on Stanley immediately.
We'll just throw him in here.
But first, the Bulldog needs to calm down. For Michael, it's a reluctant goodbye.
So can we come in tomorrow afternoon or just wait? I would not visit him. I'd probably not visit him, period.
Just wait to the end.
Yeah, he gets excited and it's really vascular and it just sets off a bit of bleeding because he's jumping around. You know, I do that.
Any operation, funeral, tremors, it's an operation. Things can go wrong.
Is it there?
Not yet. We should be able to find him.
Tim is continuing his search for a lethal funnel-web spider. The intruder is terrifying Jodie and her two daughters.
I think dark corner is where he's going to be because it's daylight now. They're nocturnal, so it's all the dark spots that I look.
Watch out, Tim, it doesn't jump out and get you. If he's not under the fridge or cupboard, perhaps he's behind the fish tank.
As soon as it rains and it's cool, the males go out for females. That's the signal. It's cool, get out. They're not going to dry out.
It's been 30 minutes since Tim's search began.
I see him.
Finally, he spots the deadly spider.
He's in here.
Be careful.
I'm always aware of the fact that you can't get complacent. I always like to remind myself, if I was a carpenter, sooner or later I'm going to hit myself on the finger with the hammer. That can't happen with a funnel web spider. You're dead. At the moment, he thinks he's hidden. So he's just sitting there crouched. But what we'll expect here in a second is, and why they're famous, as soon as I move this, we'll put his fangs up, droplets of venom on the end, ready to bite. Come on, mate. Boy, so that is with the times. And I can actually feel that fang. Tim, it hits. That's an incredible amount of force for a tiny little spider. If I slip a finger too close for just a split second, bang, we'll bite. Come on, you buddy. There you go. Good spider. There we go. That's definitely Sydney, funnel web spider, and a male. I can tell it's a male by the size. Female funnel webs, they're bigger, they look scarier, but in fact it's this little male that is the dangerous spider, 5 times more toxic than the female. There he is.
Thank you so much
That's okay.
for catching our little friend. Thank God lodge that Tim was able to locate the unaware. I'm really relieved. I was so concerned for the children after what had happened to my husband a few years ago. Finding another one in the house was quite frightening.
It's scary. I don't like his fangs.
I think they're all going to sleep easy tonight knowing that Spider's with me. And we can take him back now and save some lives.
That's excellent.
This is only the beginning for the Spider because now really he goes into a luxurious resort. He gets his self-contained little cabin. He gets a cricket once a week and we get to milk him and extract that venom that saves lives.
You can't even support his head now on his neck, so this is getting a bit urgent.
Chris is desperately trying to save the life of a black swan that staggered into this suburban backyard.
We're going to give him some fluids. I've got some saline here that put underneath his skin. This is a way of rehydrating him and hopefully that'll give him a little bit of a boost. But more importantly than that, we're trying to buy some time because in this state, he's no chance.
Shelley called Chris for help after finding the bird trapped in their soccer net.
We were quite surprised because we've never seen, obviously, a swan in our back garden. I mean, there's lots of swans at Lane Cove National Park, which is kind of close. We thought it might have flown in from there, but because it was so injured, we were really worried how it actually got here in the first place.
The most likely thing happening here is that he, just through absolute exhaustion, through not being able to find enough food, at this time of year where it's breeding season and a lot of swans are getting quite territorial, he's had to shift around and he just hasn't been able to find a home. His final last desperate act was just go searching for somewhere else to live and somewhere else to eat. And that's where he's found.
Yeah.
The fluid has bought the bird some valuable time, but now Chris needs to determine what's making the swan so ill.
Let's just check out his neck. He's got a long neck, but prone to neck injuries. It seems to be moving his neck okay. Both wings can actually operate quite well, but right now there's just no way that he has the energy to flap those wings enough to get off the ground.
Yeah.
So out in the wild, in this condition, he just wouldn't be able to survive, and a dog would attack him, or he just wouldn't be able to feed himself and would die as a result of that. But this is really his last chance now. He is quite skinny. When I feel along his breast muscle there's not much of it there. Even his legs are really skinny. What's really strange about his feet is that for a bird that is so incredibly good at flying, he's worn away the skin of his feet, so he's been walking around a lot. And that's a pretty desperate act for a bird when you can fly while you walk. This poor guy is in a terribly weak state. My hope is he doesn't have any internal injuries. The fluids I've given him will certainly help, but he needs further treatment if he's got any chance of surviving. The plan now would be to get him back to the clinic as soon as we can and really check him out and see if there's other problems going on there and get him some food, really start to rebuild his energy because he needs it.
At SASH, 2-year-old Stanley is ready for his life-saving respiratory surgery.
He's been sedated and he's obviously much calmer and quieter. We're going to open up his airways, we'll open up his nostrils because they're really narrow. His soft palate tightened up. 99 standing by. That soft palate's just sitting almost halfway down his windpipe. All bulldogs, their soft palates are a bit longer. He's a gold medal winner.
If Stanley's overgrown soft palate isn't shortened, Andrew fears the bulldog wouldn't survive another summer.
When he's breathing really hard, this is just going up and down like that, just obstructing his whole larynx. In extreme cases, if they're breathing so hard and it's a really hot day, their lungs can fill up with fluid, and that is really catastrophic. That's just a huge amount of tissue that I've had to take out there. It's really thick and fleshy, and that's the other problem. When it's so thick like that, it just fills up the whole airway.
Wayne. At the Bondi Clinic, Chris has arrived with the critically ill Swan.
He's just very weak.
Before treating the Swan, Chris has decided his new patient needs a name.
We've decided to call him Wayne, as in Wayne Swan, Australian Deputy Prime Minister and Treasurer. We just got a little bit political. Good way to guarantee that Wayne only has half the people around here like him.
Well, straight away. Whoa, really smelly.
So, no obvious injuries, wings are intact, neck's fine, but just very weak, a bit uncoordinated as well. Yeah. So I'm thinking the wobbliness is more to do with the fact he's just very low in energy and he's stumbling around. But I just want to check out his belly, just make sure there's no front bodies, no hooks, no sinkers.
An X-ray will confirm if Wayne has any internal injuries.
Straight away we can tell there are no metal objects sitting in the stomach or the digestive system. They've been really glowing a really bright white. The really obvious thing to me is just how skinny he is. There's no grey areas of muscle. It's just either bone or it's feathers or it's hair, and there's really nothing else. It's been a long time between meals for Wayne, and he's just really struggling, obviously, to make do with what he has, and what he has is very little.
It was touch and go the second time.
Back at Sash, Elizabeth has arrived at reception with her beloved cat Toby.
He's got tick paralysis, but he's just not coping. This is the third time he's had it this year, so it's just a month him off to live with him.
Lisa.
Elizabeth.
Nice to meet you. Come through to you.
So Toby had a tick on Sunday that we found.
Was it paralysis tick?
It was, yeah. So when I pulled the tick out, it left quite a crater there. And it came out quite easily, so it looked like it had done its job and was ready to fall out anyway. And then on Monday, obviously, I noticed the laboured breathing.
So they're not wanting to use his back legs, is it? It's a little bit of movement, but not much.
The tick has injected enough toxin into Toby's bloodstream to paralyse his nervous system.
Just check his face. Sometimes if they're paralysed, if the tick is on their face, can paralyse their blinking. Where was the tick found?
Right on his spine.
The fact that it's come on so quickly, I think it's really important that we just err on the side of caution with him and make sure that we cover all our bases. What I think we should do is dip off all his hair.
Okay. I just want him to be better and pull through. I think there's only so many times a pussycat can fall like this.
I really don't think Elizabeth is going to get much sleep tonight. She is so anxious about Toby having a tick. She's been down this road with tick paralysis before. She's anxious that he's going to get worse. In the first 24 to 48 hours, he can deteriorate and deteriorate fast. So it's really important that we watch him very closely.
Tim has removed a male funnel-web spider from inside a family home. Now the real work for this spider begins.
First trick's catching them, but it's another thing milking. There's a good boy. It's nothing like milking a cow. We actually want him aggressive at this point. We need to tease him gently. We need him to stand up, rear up like that aggressively. And there we go. 2 droplets of venom. 1, 2. There it is. It can take up to 1,000 milkings to make 1 ampule of any venom. When you're bitten by a funnel web spider, you know about it. Before the venom even kicks in, their fangs are half a centimetre long, and they thrust them into your flesh, and you'll know I've been bitten.
At the Bondi Clinic, Chris has a suspicion about what's causing Wayne's severe condition.
Probably the most worrying thing about Wayne right now is that muscle weakness and that lack of coordination that he has. To me, it looks a lot like botulism. Now, botulism is a toxin that attacks the nervous system. The only way to manage it in a bird like Wayne is to give him plenty of rest, plenty of food, and plenty of care, really 24 hours a day, for as long as it takes for him to get over that toxin.
There's a really slight reaction there. If it is botulism, I think it's in its very early stages, a very mild form, just because he still is able to support his neck most of the time. But I think supportive treatment with fluids and nutrition is probably going to be the answer.
To give you an idea just how skinny he is, if you have a look at his wings, really it's just being held together by this bone here. There's no fat, there's no muscle that is bulking it out. It's just skin, a bone, and a few feathers. So we're essentially giving him chook pellets. So the thing about chook food is it's incredibly high in protein and energy and also vitamins and minerals. Wayne is on the brink of absolute exhaustion, so he's going to need a bit of a hand. That hand is going to be mine. Wayne, so my long finger's becoming very, very handy. Don't shake your head. Getting that food into him and keeping it down isn't as simple as it seems.
Alright, honey. Okay, sweetie pie. We'll pop a drip in you and give you some sedation. You'll feel so much better.
Family cat Toby has lost the use of his back legs. It's the third time in just 12 months he's been the victim of a paralysis tick.
Toby's feeling really anxious. He can't use his back legs properly. He's feeling strange and he's becoming very, very stressed. So what we need to do is give him a sedative. That will take the edge off things. Hopefully it will relax, because if he becomes too stressed, then he can deteriorate very, very quickly. Let's give you a little prick now, sweetie pie. Be a good boy, please. Good boy.
Toby now needs to be administered the tick anti-serum to try and combat the toxin that's infiltrated his bloodstream.
You'll feel much better with this. Toby's owner removed a tick from him a few days ago, and what we need to work out is he showing signs from that tick, or is there another tick hiding under his hair coat somewhere? So what we need to do is shave off all his hair so that we can make sure that there's no other tick.
Come on, Lisa, hand over the cookies.
Haven't I earned it yet?
No, not yet. He's had a tick, he doesn't need anything for us to have to treat him tonight.
Lisa's renowned as the worst hairdresser at Satch. Vet nurses Belinda and Mark are in charge of this clinic.
So it's clear that everyone is amused by the fact that I cannot clip. You've got multiple people around helping Toby with his beautiful haircut, but I'm banned from the room. I think I'll just stick to my paperwork. It's probably best for me, best for the cat, best for Elizabeth. Keep it that way.
15 minutes later, Toby is sporting a whole new look.
How's it going? Look at you, handsome boys. You're a handsome boy. Look at those flat ears. He's so Any more ticks? Oh, no. Okay. All right, let's pop it down. Yes. So we found a tick crater, which is a clear indication that a paralysis tick was there. It's a big scabby hole in their skin that the tick leaves behind once it's fallen off or it's been removed. Fortunately, I haven't found any other ticks, so I think that the tick that was on him a few days ago is the culprit for his signs that he's showing now. Oh, no. It's terrible. All we have to do now is watch him very, very closely, treat any signs that arise, and hope that he doesn't deteriorate.
That's just a huge amount of tissue they'll have to take out there.
A huge chunk of Stanley's overgrown palate has been removed to help him breathe normally. Next, Andrew needs to widen Stanley's nostrils.
What I'm going to do is just take a wedge of tissue out and super expose it. It'll be much easier for him air to get in. So now we just make sure they wake up quietly and slowly.
Although Andrew's happy with the way the surgery has gone, any excitement to Stanley can cause swelling or rupturing of his delicate blood vessels.
If we don't watch him, he can get suffocate, obstruct and die. So he'll basically be getting 24-hour care for the next 36 hours.
So you come to the airplane, but for a bird to can't fly, it's not really funny for you.
Back at the Bondi Clinic, feeding Wayne is proving to be a real challenge.
How's the finger? Taste all right? The worry you always have with these birds with the very long necks is that they've got a great regurgitation reflex. If he's not liking the food or if it's just too stressful for him to handle, as quickly as it goes down, he'll just bring it straight back up. So he's trying to feed him. I'm just really keen to keep his head nice and high. All good. A little napkin for that.
It's been a huge day for Wayne, but it's not over yet. Chris now needs to clear the swan of the lice attacking his body.
Should we get rid of those parasites? No, I would say yes. It's a yes. No, it's definitely a yes. Yeah, I'm like a politician to lie, I know, but in this situation, it should be a yes. Parasites? It's crawling on you. No. How big is it?
Wayne's decided to share the parasite love with new best friend Neil.
No, it's never nice, but it's a feather louse and it's mate. Where's your head? You get it? Yeah. That's what we have. Ooh, looks like it's been pregnant. No eggs in there. And it's pretty big, eh? Straight to the barbers, shaking it.
After worming Wayne, Chris begins the final stage in the swan's treatment.
The lice you can see on Wayne are really a sign his own immune system just hasn't been coping, because he should be able to get rid of those himself. But with this spray, we'll be able to get rid of the ones that are on him right now, and hopefully, once he gets some food into him, he'll be able to take care of the rest. It should ease the stress, Wayne. It really should.
Oh, that get me?
Oh, that's strong, man. Poor Neil, you got to feel for him. I mean, the lice are one thing, but then for Wayne to pull him, it's really stretching the friendship. It's one vote that Wayne's lost there.
Wayne, you wouldn't get away with that in Parliament House. Why'd you do it here?
We've done everything we can now to help Wayne, but the fact is, he's so incredibly weak. He can't even flap his wings, so he's got no chance right now of being returned to the wild. What he needs is a lot of rest and a lot of care, so he's going to go off to Wise.
He's going to need a lot more to do that. Plenty of food, plenty of fluids.
All those parasites trying to suck the energy out of him, then he's a much better chance of actually making a full recovery.
There we go. 2 droplets of venom. 1, 2. Back at the Australian Reptile Park, Tim is finishing one of the world's most dangerous jobs, milking a lethal funnel-web spider.
Now, this is our little mate here, and he looks pretty vicious. He's a male. But have a look at a female. They are scary. Whoa, look at that. I wouldn't be surprised if those fangs would almost go through plastic. Female's almost twice the size. Look at that. She's like some kind of kung fu funnel web. Look at these 2 spiders. Both of them are just there, fangs reared at me. You know, I'm telling them, it's all right, guys. I'm finished. Look at it. Have a look at them. Settle down. Who would I rather be, a female or male funnel web? Female's twice the size. Male is 5 times more toxic. But the female eats him after they mate. I don't know. Flush it out. Our biggest problem with the funnel web program is access to funnel webs. We need community support. We need people to tell us, I have a funnel web. We collect those spiders, milk them, save lives. I've got a little reward for you. Oh, that is one hungry spider.
That's my little mouse. You get stronger? No. Yes, you are.
Last night, Toby arrived at Sash unable to walk after being bitten by a paralysis tick. Today, there are still signs of the poison attacking his system.
How embarrassing, Toby. Yeah, absolutely. It wasn't me who did the haircut, so I can't get blamed. Toby's going to go home today. His mum is very anxious to see him. She's going to look after him at home and continue the rest of his nursing care. And it can take up to a few weeks for him to really regain his strength. So he might be wobbling the back legs for the next couple of weeks. He's going to have to be kept indoors, really strictly watched, making sure he's eating and drinking, going to the toilet normally. I think she's going to have her hands full.
Owner Elizabeth has arrived with plenty of extra hands to help Toby. Arcadia and Max are ready for the job.
He likes me petting him and hugging a lot.
I'm just hoping they'll be quiet enough to give Toby the rest he needs. So we have to be very conscious of the fact that we've got a sick cat at home.
Hi. Oh, yeah. I've got a surprise for you in here. Look who's in here. Hey, darling.
Naturally, I came in quite concerned, but I'm very relieved that we can bring Toby home.
What do you guys think of the haircut?
Sort of good.
Sort of good? He doesn't want to look at me. And I didn't even cut his hair. Toby was very lucky that it wasn't me with the clipper blades. Goodbye.
Thanks again.
See you later. My pleasure. Take care. Bye, Toby.
Hello, Stanley. Hey, you can come out and see what you're doing? I can't hear you.
Stanley is also waiting for his turn to go home. It's hard to believe that when Stanley first arrived at Sash, the staff could barely hear themselves think above the bulldog's laboured breathing.
Sammy, good boy, Kenny.
It's been an amazing transformation.
It's a bit better, isn't it, mate?
Good job. Really, really good. I definitely couldn't hope for anything better than this in just a few days down the track.
Sit. Oh, what a good sit. What a good boy. Can I look at your nose? That's doing here very well. You're not snoring too much. Yeah, I know. Yeah, I know. Good. Hey. Oh, that's a good boy. Yes, okay.
The proof of the pudding's going to be when he goes out and meets Michael and Brittany, because they get really excited. And if he doesn't sound like a steam train after that, then I'll have done the job.
I'm excited to see him, but a bit nervous because I just want him to be better, really.
Stan!
Be there. Really excited.
Don't excite him too much.
Stanley was so excited to see Brittany and Mike, but he was quiet as a mouse. He just couldn't hear you. That means I've done what I set out to do.
I'm very excited. I'm very excited.
Thank you so much for everything. Thanks a lot.
Yeah. This summer will be a breeze for him. I think he's going to have a pretty normal bulldog life.
Something that comes with you, taking care of you. It's all right. All the food you want, all the drink you want. It's like an all expenses paid junket. And they get those motives.
At the Bondi Clinic, Chris is confident Wayne is now in a stable enough condition to be handed over to rescue organisation Wines.
Hey guys, thanks for coming in. Alright, so it's time to meet Wayne.
Volunteers Katrina and Justin will be Wayne's new foster family.
Oh, yeah.
Right now, what Wayne needs is rest. He needs food, but also he needs 24-hour care if he's going to be any chance of getting through this.
So he's had some fluids, he's had an x-ray which was clear, treated him for his parasites and also wormed him. So he's all yours.
Yes, oh, I'm looking forward to it.
But look, the one thing we've really noticed is just how incredibly weak he is.
Yes,
So.
they are usually very aggressive. He would be up on his feet now and when they have a
Yeah. So look, if you could take him in and
definitely.
give him all the nutrition he needs and let him rest up, then that'll be pretty good.
Very fun. We've got some swans at home, so we'll have lots of company.
Wayne now gets to swan off to 5-star accommodation for swans with Justin and Katrina. From there, he's going to get his strength back, and then and only then, Wayne, will he go looking for love. They're the doctor's instructions. Don't go looking for love unless you're ready, Wayne. It's going to take all your strength.
Hi, I'm Dr. Danny Busek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.
A vegan taco. A vegetarian taco. French fries and beer are vegan, so you tell me. But seriously, the easy part for most of my clients who go to make my world a better place. Yes! Walking with me.
Today I'm heading to Fiji to meet up with a truly extraordinary patient. I've been over there before and been a part of health clinics, mainly because they have such a small amount of equipment, so few vets, and so many animals that are in desperate need of some sort of help. But it's the story of Poppy that's really caught my attention.
This is Poppy. Her nose was cut off by a machete in a horrific hunting accident. Against the odds, she survived. But now these terrible injuries have left her in constant danger from life-threatening infection.
The plan is to fly her back here to Australia for facial reconstructive surgery. But the reality is, we just don't know if it's going to work, but we'll try.
It's a 4-hour flight to Nandi. Eagerly awaiting in the arrivals hall is Julie Hoskerson, the woman leading the campaign to save Poppy.
Julie?
Chris!
How are you?
How are you?
Hello to finally meet you.
Welcome to Fiji.
Thank you so much. This must just be such a relief this is finally happening.
We've been waiting a long time for you to get here.
Yeah. How's Poppy?
She's great.
Yeah.
She knows you're coming.
Let's go and see
Shall we
her.
go?
Yeah, it'd be great. Wow.
Julie is now taking Chris to Poppy's temporary home at the Animals Fiji Clinic. The charity looks after stray and injured animals.
This is Poppy's place.
It's taken Julie 7 months to raise the funds for Poppy's crucial surgery.
Okay.
Look forward to meeting you finally. Oh, there she is. Hey, Sue.
Hello.
Hello, how are you?
Nice to meet you.
Hello, Poppy.
Hey, Ron. Hey, how you doing?
Wow, look at you, Ron.
She can be very frightening for people to look at. I forget now how frightening she is to actually see because she's just Poppy.
Spend so much time staring at that face in photos and nerve. So sometimes you get there's a dog attached to it, don't you? I've obviously seen photos of Poppy before I got to Fiji, but meeting her in person is so incredibly different. There's an element of being surprised, of being a little bit shocked by how she looks, but I'm more just in awe of how she's managed to not just cope, but really get on with her life with this sort of injury.
Good girl, yeah, she's a good girl.
And it's a sad start. We hope it's going to have a happy ending, don't we? I'm sure it is.
I was alerted to the poppy situation when I was up in a rural part of Fiji by a local headmaster who said that there was a little dog in the playground scavenging for food. He said the children were quite frightened by the look of the dog because part of her face was missing. The first day, right here at the clinic that Poppy came in, my hand started to shake. The gravity of her injury, the gravity of her, how thin she was, how emaciated. I thought, I just don't know if this little dog can survive. So, of course, I immediately formed an amazing bond with her and thought we have to do everything that we can. If she's come this far and she's survived such an awful injury, we've got to
Dude,
do
I'm
it.
trying to think.
She's 25 kilos now. She came in at 9.5 kilos. Yeah, she was skin and bone. And look at her, she's beautiful now.
I saw those photos and she was so skinny. You've done an incredible job to get her to this point. You really have.
When I first saw Poppy, my heart ached for her. And I think the fact that she was so happy made us all feel worse about it because she could accept it. And she still liked people. Love, that's it. She just wants loving.
Hello, yeah. Thank you. It's nice to meet you too. I think it's easy for your first instinct almost to be one of pity for Poppy, but when she comes over and straight away wants pats, wants to be in your face, wants to share her love, and then she puts a paw up on you, you think, she's a normal dog. She just wants affection. She wants to be with you. She wants to be part of your life. And if a person had gone through this, they'd probably withdraw and become very, very quiet and very aware of their situation, but she doesn't have awareness of how she looks. And really, she's able to put what's happened behind her, and it's probably really so important in what lies ahead for her.
Only reconstructive surgery will give this little orphan quality of life and a possible future with a new family.
She does deserve a second chance. I'm really hopeful we can give it to her.
Come on, Poppy. Come on. Good girl. Good girl. Come on, Poppy.
But before Poppy gets the all clear to get on the plane, she needs to pass one final dog check to make sure she's fit to enter quarantine in Australia.
Obviously, with her nose being so shortened there, but the worry is always going to be, until she has an operation, the risk of infection. Just because everything is so exposed, it's very easy for bacteria to get in there into what is a very good environment for them to breed.
Any sign of infection can jeopardise her meeting strict quarantine requirements.
What I'm looking for are any areas which are discoloured or any sign of any build-up of anything nasty, but that's really not there, which is once again a credit to you.
Not only was Poppy the victim of a shocking hunting accident, she has also fought malnutrition and disease.
Obviously, her personality isn't the only thing that's resilient. Her heart sounds great. Despite having heartworm, she's got a beautiful heart. Big booming beats, no murmurs. Okay. Really happy with that. As part of a normal physical examination for a dog, I usually check all over their body. When I get to Poppy's ribs, I have trouble feeling them. Normally, what I'd like to do is feel each and every rib, and a few go missing under a layer of, I'm not really sure what it is, but it could be fat. I don't know.
Fat and happy.
It's under a layer of happiness, right?
Yes.
If there's a dog that deserves to be spoiled rotten, she's standing right in front of us. For her, it's an energy reserve. It helps her immune system. It means that she's stronger. And what she needs for the next month and really for the rest of her life is strength. She needs to be able to get through every day, but then get through what's going to be a tough time for her with this operation.
You're good to go.
It's very easy to see just how much Poppy means to Sue. She's been here since day one. Really helped her through every little obstacle she's had to overcome. And now it's going to be hard to see her go, but no doubt about that.
All this love, I know. You don't know what's going on, do you? I will miss Poppy very much. She's become very dear to me.
Was your last night in Fiji, my girl? Your last night? Really good.
Drink some kava, do you think?
No, a Fiji bitter. Everyone in Fiji will be very eagerly awaiting the next instalment to see how she is. So you make sure you look after her.
We will.
Yeah.
To
Today I've done as much work as I can for Poppy, but there is still some more work to be done. So I'm going to meet up with 2 other vets who are putting on a clinic. You might just know them. Yeah, it's my dad, Graham, who I'm sure you know is a vet. He's doing some work with Lisa from SASH, and they've set up a clinic in one of the local villages.
Welcome to the village. Welcome.
They've all got appointments, do they?
First time in a few weeks. A group of doctor vet to come and clinic the animals, which is very good. We love it.
In Chris and Lisa's first visit to Fiji, the vets were involved in desexing animals in primitive conditions. It was rewarding and touching.
We've got no equipment, fluids, so it does really get my heart rate up and being very anxious.
Today's clinic promises an interesting mix of patients.
She's been drenched for worms, so what would you to do? Could be interesting.
This little puppy's been in a car accident and has got a fracture in his back leg. But I'm more worried about the colour of his gums. He's really, really pale. It's over 30 degrees here and he's getting quite dehydrated. Fiji's animals are in desperate need of help here, and the Fijians need to learn how to look after their animals. They need education and they need volunteers, vets from around the world to come and help them do that. There's no way we can do surgery here to fix this broken leg. I guess what we have to do is try and do what we can for now and just hope for the best.
Because of the cuts bleeding on his comb. Does he fight with the other roosters? Only fights the dog and the cat. Oh, a tough rooster. He's very skinny. Yeah, I think he is. Because he is so skinny, I'm worried that he may actually have some parasites. So we'll worm our rooster Aussie, and that'll probably make him bigger and stronger. So not only does he fight the dogs and cats, he may win against the dogs and cats too. Doesn't even strike me. No, that's what's funny about that. A big one for a little girl. Big one. Yeah.
At the end of a busy afternoon, the Aussie contingent is now trying out a Fiji favourite.
The chief goes first. It's traditional.
Work on your water, please.
I know I will. Don't put it in front of my screen.
Don't get in the way of tradition. It's kind of an interesting one. It's like nothing you've ever tasted before. It's like licking a dirty potato. It's different. Lisa's clearly loving the carver, but I think Dad's seriously getting into it. I've been to Fiji enough to know how these things end, and it's normally very, very late at night. So with my early start in the morning, I'm going to take the chance to bail now.
It's just after dawn in Fiji. Chris and Julie are finally sending Poppy on her landmark flight to Australia, where she'll be held in quarantine for 4 weeks.
Look where you are, at the airport. 6 o'clock in the morning, and Poppy already here, ready to go.
She been good?
She's going to be one of the first Fijian dogs to fly, let alone have her own business-class crate. So it's a lot to take in, but it's an exciting day for her.
A little bit anxious, baby. Yeah, a little bit anxious. It's all right. It's always emotional to leave Fiji for me, but to see Poppy leaving Fiji, this is her home. She's coming to Australia. She's not coming back, but she's going to a great life. It's really emotional.
You ready for the trip, Jill? Yeah? Had a word with the airline about your meal, about your movie.
Poppy's story has certainly inspired a lot of generosity. All travel costs have kindly been covered by Air Pacific, and they're not the only ones.
Poppy will be loaded into a specially made crate, which has been donated.
That's very sweet. You're so beautiful, aren't you? Yeah? You'll be okay. What should be? What a good girl.
Casey Quimby from Animals Fiji has also come to say goodbye.
It's really emotional, isn't it?
Like this morning, she was Poppy was.
Such a responsibility.
It's important to remember that this is really just the beginning. From here, she goes to Australia, she's in quarantine, then the big operation, which really, hopefully, sets her up for the rest of her life. It's Chris Brown here to see Poppy. Thank you.
Poppy has been at the Eastern Creek Quarantine Station for 4 weeks. After a quick checkup from Chris, she's due to be released.
Hi, baby. It's home time, honey.
She must have been through so much, and it would have been really hard for her to come here with strange people and try to trust us again, but she's done really well.
Hi, Poppy. Hey, Pops. Oh, it's good to see you again. Has she been making friends in here?
Lots. All the girls love her. Yeah, it's amazing. The ones that are hurt the most are the ones who give people the most.
While I'm here, I do need to give a bit of a checkup, okay? She's got a big operation coming up.
If Poppy is showing any signs of illness, her scheduled surgery to repair her nose could be in jeopardy.
Keeping your nose clean hasn't been a problem?
It's been fantastic.
Yeah.
Every day it's clean. I've not once seen it bleeding or dirty at all.
Her glands feel quite normal around her neck and head there, which is a good sign. There's no infection. Just feeling her ribs, Rachel. I think she's got a beach body back. Slim down. Quarantine seems like it could be an ordeal, but when you remember everything that Poppy's been through, this is nothing. Just a little bit longer. Keep on enjoying the resort here.
As soon as Poppy is released from quarantine, she'll travel to Sash with her guardian Julie.
Now, I reckon you're pretty excited about today.
Hello again.
How are you?
I'm very excited about today. Nice to see you again.
You too. End of quarantine, but start of everything else.
She knows where she's going. She's out of here.
Do you think she's going to know something's going on here?
Yeah, definitely. She's a smart dog, isn't she? She is, yeah.
Over the last month, dog walker Terry Dubois has also formed a very close bond with Poppy.
She touched me in a way that not many dogs do.
She just has such a sweet nature and so understanding and caring.
Hey, girl. Hello. Your fans are here.
Oh, that's so good.
There's a lot of love for you, isn't there?
Last one.
I don't want to be the person to break this up. Here you go.
I think whoever becomes her new mum and dad are going to be very, very lucky people. Nameless.
You're right.
It's there again. I go and visit her. Carrie, she moves to the other side of Australia. We're leaving. Cool.
What's incredible for me is that in a quarantine centre like this, they would have hundreds of dogs to look after. But Poppy has been someone pretty special, quite clearly, because Terry and Rachel are all finding this a very hard moment.
Lucky Rachel's here for me. Good.
See you soon. No worries. Take care. And good luck.
Thanks.
You won't need it.
Thank you.
Julie really kicked off this whole journey for Poppy, and now she's in charge of the next stage, which is taking Poppy up to Sash to see Henry Marcheski. Now comes the interesting part.
We wouldn't be looking at recreating a muzzle for her. We'd be looking at tidying this up and
Yes and no. I mean, it's sort of recreating a muzzle. We're going to try and use these lips that she's got on the side and bring them forward over there and leave her with a slit, if you like, through which she can breathe. But so it won't look normal, but it will just be more functional and give her as normal a life as we possibly can. We will certainly make her look better, but that's not the purpose of the surgery. The purpose is to decrease the risk of her sucking things up into her nose like grass seeds, because that can be really dangerous. They can end up migrating all the way into the brain. And, I mean, that's obviously fatal.
we don't want to take any chances with this girl. You've got thousands of fans, haven't you, Poppy?
She's on Facebook.
She has got her own Facebook page.
Well, I'm not a friend yet.
Yeah. She needs all the friends she can get. She's got incredible support. So, what I'm thinking about today is those people. And, I just feel very grateful.
As for costs, we'll basically cover it. So,
All three.
yeah, we'll cover the whole thing.
That's amazing. My goodness, that's amazing, my baby. I don't know that she heard you, but thank you, Andrew. That's extraordinary. I don't know what to say.
The cost of Poppy's facial reconstruction is $10,000.
We decided to do this pro bono for Julie, and I know they've raised a lot of money so that we can do it, but I think that money would be better spent in Fiji. There are a lot of dogs over there that need a lot of care, which they normally wouldn't get. So if we can do our bit so they can, then not only do we help Poppy, but we help all those other dogs as well.
You see, this little dog creates miracles. I'm convinced of it. That's it. It's your latest miracle, my baby.
Next day at Sash, Fiji's most famous dog is being anaesthetised, so specialist surgeon Andrew Marchevsky can map out his strategy.
Is she any good?
Yeah, she was great.
Reconstructing Poppy's face requires groundbreaking surgery with no guarantee of a successful outcome.
Today I'm just trying to get a bit of an idea of actually how much lip I'd like to play with, because I've got to get her lips on the side of the face brought round to the front of the nose. She's sort of got plenty of lip, but it's all back there, right sort of towards the angle of the mouth. It might actually be a bit more complex than I was hoping. You can just see right down the nostrils, almost the back of the skull just about, so I think providing a bit of protection is going to help her out. She's already got a bit of foreign material down there anyway. If we don't cover this up, she's going to be sniffing around, sure as eggs, she's going to sniff a grass seed or something up there. And that'll go right up the back of the nose, and then potentially even into a brain, because they can burrow through, and that would be an absolute disaster for them.
As Poppy's examination continues, Andrew uncovers further complications.
One of her tooth roots is fully exposed, and can't be a good thing to know if my tooth was exposed, it would hurt like hell, so we'll have to look at that. Finally,
Hi, Andrew. Oh my goodness.
Poppy, Nadine,
Oh my goodness, poor Poppy.
Andrew's called in oral surgeon Nadine Fiani to get her opinion on Poppy's teeth.
This canine has been broken so badly that I'm actually inside the canine tooth itself, so it's exposed the nerve of the tooth. This creates a huge highway right into her jaw that's probably set up an infection in the jaw itself. I have seen a lot of facial injuries, but hers is probably the worst. Okay, so this is the tooth. There's a small abscess that's formed at the very tip of the tooth, at the very root. That tooth just needs to go now. And this guy, you can see the bones just sort of been cut off. Again, that tooth needs to go. It will set up an infection if we don't address it properly.
really what I needed to do today was get an idea what I'm dealing with. It's a complex surgery, so I'm going to need some thinking time.
Gosh, look at that. So sad. We'll fix you right up. Good girl.
What's going on in here? Poppy, you've been telling stories about Fiji. They're all worked up. Sorry now, there. What you see here?
It's finally Poppy's surgery day. It's been 8 months since her nose was cut off, and she nearly bled to death.
Yeah, the amazing thing is that after everything that Poppy's been through, the accident, her recovery from that, her trip from Fiji, her quarantine, this is probably the thing that is going to be the biggest challenge to her. She's in a really foreign environment. Of course, she has an operation today. It's a big ask for her, but I think God's up to it. Poppy is. Now, before she goes into the operation, someone to come out and show you how brave she's been. Look at her.
How have you been, my girl? Are you all right? Be brave, my girl. My darling, nothing's never been anything but brave. She must be the bravest dog in the world, so she's going to be fine. Yeah, you'll be good. You'll be good for everybody.
I never actually thought that this was possible. I didn't know that it was going to be possible to get her here. I didn't know it was going to be possible to have this kind of surgery. I'm ready. I just want to see it be successful.
Look after my girl.
Thank you. I'll see you soon.
I'll see you soon.
I remember the first day I saw Poppy in Fiji, and she was so thin. I mean, she was a skeleton, and she had this dreadful injury, and I couldn't stop shaking. I'm just remembering what she looked like then, and how far she's come.
Flipping hate this game.
And the fact that we've been able to do this for her, I never thought it would happen. I knew something had to happen, but I never thought we'd get this lucky.
It's the first time I've seen her a little bit apprehensive. Normally she's so confident and calm, but hey,
The operation will be split into 2 stages. Oral surgeon Nadine Fiani will be leading the first procedure.
We're primarily removing the teeth because they're actually quite badly diseased. So this guy here, you can see that big black dot there?
Yeah.
That's the nerve, and it's completely exposed, and the tooth is dead, and that needs to come out, otherwise it will interfere with the healing later on. But what it also does is it will free up quite a bit of room for us to be able to rotate her lip around.
So it looks like when that blade came down, did it slice that tooth actually?
It sure has, yeah. So this would have had a full crown on it, a great big fang, and it's just comes right down. You can see how clean cut it is. I've never seen a horrific injury like this before. It's so sad to think that she lived for months and months with the bleeding, with a great big open wound, and yet she survived. It's incredible. Below the gum is about 60% of the tooth. The top is about 40%, and so most of that's gone. So she lost a good whack of her tooth from machete.
The important part of these removals is that you just cannot afford to damage any of the tissue around here. There's not much to play with, and if there are any tears there, it makes Andrew's job so much more difficult.
It's now time for the whole team to scrub in for the second stage of the operation.
I wish for the day where I'm not as nervous going into bigger surgery.
I thought that I was going to sleep on this overnight, but I ended up not doing a whole lot of sleeping. I just had these pains that popped going through my head the whole night. And it would be rare for you to do something where it is a genuine first time, but it's a tough first time too. Yeah. And that's what this is. I mean, if it was an acute injury or something like that, I think things would be much easier, but this is interesting.
Surviving her horrific wounds was miraculous, but Poppy's future now depends on the facial reconstruction.
I'm a bit nervous going into surgery. I don't say that very often. I don't know what we're going to have to deal with. All I know is it's not going to be straightforward, and we're going to have to do a fair bit of thinking to get it right. This is something that really hasn't been attempted before on this scale. That we're trying to do something to his face that will be incredibly difficult, and we won't really know how it's going to go until we're in there. I'm going to take this. It's about to there. So it's about decreasing this and saying something horrible into that nose and causing a problem. Hopefully the end of it should be better. One of the worries is that despite all the pain that we've known, we're going to get in there and find that we just don't have enough tissue. We really should do the program first. It's sort of one of those analysis to rotate at the same time. Well, actually, slowly change the original form. Rush it, you just end up damaging the tissue and you've got nothing to work with. And then we look at this round here as well.
Right.
And because I think
Not only that, we think you're going to need to elevate from here as well, so that whole flap lifts.
It's been an emotional day for Julie.
It feels really, really hard now. It feels hard waiting. It feels hard thinking of her going through so much.
You almost realize just how thickened everything is around her lips there. Yeah, it's very abnormal. Normally the skin's lip tissue is very thin. It's very thick and scarred. And that's why I have all the problems with that. At the moment, the nasopharynx and the mouth are still connected. I'm fighting against the fact this has been going for 7 or 8 months and we're trying to fix it in 4 hours. Sometimes the hardest thing to do is say, no, that's enough, we've got to stop. You just have to accept there's another surgery to do.
Hi. You must be exhausted.
A little bit. So I think she's gone through the operation really well. But she's gone through this operation well. So she is going to get a second operation.
Right.
The reason for that is that when we got in there and we moved the lips back together and closed off that bubble over her nose, it's too much then to try and repair everything internally as well, actually inside her mouth. We don't actually have enough tissue, enough room to do that right now. So that's why we need the second operation. And do you want to come and see her tomorrow?
Yes, please.
We obviously don't normally do this because she's sort of under anesthetic, but then we'll just
Yeah, alright, thank you. Yeah, no, it would be wonderful. there's just so many people who've helped, and I don't know what it is about one little dog that's created so much love. I just think about what would happen to her if Jamie got this lucky.
Not quite finished.
Not quite finished. Oh, baby. Oh, sweetheart. Oh, the dear little thing. She looks amazing, and the fact they've been able to do that in, they've been in there for hours, but the fact that they've managed to do that is extraordinary. Oh, thank you. Oh, baby, beautiful.
Have you got them make it through 2 surgeries?
This is, oh, yeah.
The next couple of weeks, I'll get you with the hand feed puppy. I don't really want sort of trying to pick up food with that nose because it's delicate. It's trying to heal unless you try to use it. The chance that things have broken down.
And thanks for letting me see her.
No, that's all right.
Yeah, it's just great to see that she's okay and far on her way.
Yes.
Come on, baby. It's not cold. Did you come up start? Get your lunch.
It's been 3 weeks since Poppy's first surgery. Today is the last chance to fix the gaping wound caused by a shooting accident in Fiji.
Hey, Pop. What are you doing? That's a good dog. How's that nose looking?
It's been quite itchy, but she's been really well. I mean, she's eating like a horse. The rest of the time she spends sunbathing.
Oh, nice. She's got a bit of life.
She has.
This has to work today. Poppy's been through such an ordeal, right from hemorrhage and injury all the way through to being all over Australia. So much invested in her. This just has to work. So there's a bit of pressure. Come on, Andrew. Come on, Lee. Come on. There you go. It's easy, isn't it? By no means will be finished because the left her as she is. She's not going to be normal. So what if I try and do is make an incision just here, yeah, and bring those 2 lips together. The way she is at the moment, her nose and mouth are sort of all together. I mean, there's no separation. So we're using some of her lip tissue to become part of her nasal cavity to separate it from the mouth.
Yeah, that's what generally sort of think twice about this. Because you don't want to close it off too much.
No, we do want to close this bit.
Yeah.
There's as much pressure on now, I think, as there was before, because last time we pulled out and said, okay, we'll fix this next time. There's no next time, it's still going to be tough. That hole there is going straight into her nose. I'm really pleased with that.
I didn't expect them to come quite as easily, I guess.
Yeah. She couldn't get the 2 of them.
Just as Andrew is starting to relax, he's confronted with one final problem.
It's too closed over. Didn't expect that.
Yeah.
Separated the nose from the mouth. But the actual nostril that we've got left is really narrow. And we're just worried she won't be able to pass enough there. So we're just going to try and open this up. This might be the hardest part of this whole story.
He would have got well over 260 pounds. And that's what I did. I put faith in him and in the program itself. And weight started coming off.
My goal was to lose 10% of my body weight, and I lost 18 pounds. And if he lost 30 pounds,
I went from 44-inch waist to 36, 260 something to 205.
I lost 14 and a half pounds, and that was in 22 days. So that was enough to say, why don't you just keep going back to size 10?
The initial 25 days was down 2 sizes, and since then I've gone down another size.
At 42 days, I lost 20 pounds. And that's a fact. I lost 20 pounds of fat. A fat, no muscle. But all my muscle stayed.
I have a flat belly for the first time since having some children.
But it's easier to commit to 3 weeks than it is to say.
I think we'll just cut him along
Get it, boys. Finally in the game.
everything's holding together. I guess there's still a risk that so much tissue might break down and end up with a hole there, so we'll have to watch that. Who's that? Wow. Hello. Good seeing you. Yeah. And look at you. It's a bit different.
It's been 4 days since Poppy's final surgery.
She's really well. That's such a good result.
A little nervous before the operation. You need to get nervous before operation.
Yeah, well, you keep showing your toes.
Look at Poppy. Wow. You know, just somehow Mary managed to craft a nose for her. And she looks fine. Most importantly, she looks happy.
She's a gentle soul. She's just taking everything in stride. Whatever gets thrown at her, she gets up on.
All the tough stuff has been taken care of. Now she has the rest of her life to enjoy. Show her Pop. Here we go. Good girl.
I can't wait to see how Julie responds. Julie's been there from the start. This is going to be good. Who's there, Pop?
Legit, I hate this game so much. Last game only is my dad just because of lag.
Oh, that's wonderful.
How does it go?
Oh my goodness, I can't believe it. That looks great.
I was watching Julie when she saw Poppy. Just this total look of happiness. All the hard work had been worth it.
I think you look just gorgeous.
To be able to see what it was, how awful it was to what it is now, where she's functioned in pity. It's terrific.
We have a little something from the Cyclone crew. And what we'd like to do is, as soon as her nose is fully healed, we're going to put a dome shot in there so we don't forget her.
That's impossible. But
She will never forget you. Thank you. It's just amazing.
all right.
So goodbye. You kind, truthfully.
She got her feet down. Right for that sort of photo, by the way.
The dome is finished. It is fantastic. She looks. What I'm going to do is Blood Shoppers sponsor a vet appeal. Yeah. Which is about raising the funds to get the permanent paid vet on staff at the clinic that looked after her. And that's Poppy's way of saying thank you.
I've spent enough time working in Fiji to know that Poppy's story is just one of many. But what Poppy has shown is that if everyone does stick together, if everyone does help out and truly believe in making a better future for all animals there, then it can be done.
Come on. She looks terrific. She can settle into Australia, learn to speak Australia. That will give us time for her little nose to heal and look really cute.
I think you'll love this song, won't you?
And then we'll choose Poppy's forever.
Hi, I'm Dr. Danny Busek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button.
Yes.
Queensland's been absolutely hammered by storms and floods lately, and it's taken a huge toll on the wildlife. Right now, I'm on the Sunshine Coast to help out 2 girls called the Pelican Twins, who have dedicated their lives to helping sick and injured birds. They've got 10 pelican chicks that have been orphaned that I'm going to look at, but one in particular is quite sick. I've heard a lot about pelican twins. Now, I've never met them, but from all reports, once you do, you'll never forget them. Hello.
Hi.
How you going, mate?
Good.
I'm Chris.
Paula and Bridget.
I'm sure I've heard. That's very sweet. Thank you.
And thank you for coming. I know that you're up here.
Yeah, no problem at all.
Yes.
The angels look the same. They speak the same. At the same time, where did all those guys come from?
They came from Idaho Dam when the big drugs were on.
One might start a sentence, but they both finish it.
And the parents got killed. There's some people who say a baby chick got killed as well.
Really?
was the same.
So, you guys talk at the same time.
Yeah, we don't know this, but we end up doing. Yeah.
Following Reese's flight, the twins rescued these 10 baby pelicans.
That's my hand. That's still my hand.
Yeah.
You may notice the fish went down a long time ago.
You're doing good, Chris. As soon as we laid eyes on them, we got goosebumps and watery eyes, and because we've never seen one before, because we've been doing this for 14 years, and we've always wanted to see a baby pelican.
But one of the orphan chicks is in a critical condition.
Oh, wow.
Yes. We can pick her up and then take her in, and you can have a better look at her on the table in there.
And that problem there is pretty visible, isn't it?
Yes. Yes.
You can see when she holds her head back, she has to almost move her head around.
Yes, and she
Big head bubble there.
keeps swallowing as well, so she must think that there's something in her throat.
Yeah. What's her name?
Johnny.
Johnny.
Yeah, just in case she's a boy or a girl. Yes.
It's actually quite normal for pelicans to have a little bit of air underneath their skin, but it's normally on their chest and almost serves as a bit of buoyancy for them and also makes them lighter when they fly. But to have this sort of swelling in the neck like this is very abnormal. That has to have an effect on how well she can eat.
Yes.
Because the base of her mouth is just full of that swelling there.
Yes.
It's going to affect how well she eats because the fish has to push past that, how well she drinks, and really, because that neck's so crucial to their balance, how well she walks around. So we definitely need to get rid of that so she can actually get a normal meal in there
Yes.
and grow properly because at the moment she's getting left behind by everyone else.
Oh, yes, she is. Which is very sad. She's really red. She seems really agitated and itchy.
10-week-old Nala is being admitted to the Bondi Referral Hospital, SASH.
Yeah, she's been like biting paws and stuff.
The golden retriever puppy has suddenly developed a swollen face. It's now so bad that she can barely see.
Yeah, it's very sad. You kind of feel you don't know what she's trying to tell you. Yeah.
Olivia and Yuki have only had their new baby for 2 weeks.
You do get scared though. Just want to make sure that's nothing serious.
Let's have a better look at your face now. I know. My goodness, you look ridiculous. So she's all swollen around the eyes, can barely open her eyes. Lips. She's got little hives under her ears. So what she may have done is she's either come into contact with something like grass or some sort of plant that's caused an allergic reaction, or she may have had an insect find her nose and has just caused her to become itchy and swollen all over. No. This is a pretty awful feeling. I know from people who have allergic reactions, you feel itchy, you feel scratchy in your throat, when your eyes swell up, you can barely see, and she just wants to rip her skin off. So she's feeling absolutely awful.
We can start by feeling around the neck. Because once we know what's inside there, we can work out a plan about how to get it out.
Yes.
The Pelican twins have asked Chris to help them save a chick with a severely swollen neck. Johnny is struggling to keep down food.
The swelling itself feels quite soft, so most likely it's air, but there is a chance it could be fluid. If it's fluid, we could be in real trouble here.
Little prick Johnny.
Dude.
See that?
Yes.
So, tell us what's in there.
Yes.
So it's air.
Yes.
The thing about all birds is they have air sacs, as you know, which are those little
It's like bubble
balloons.
wrap.
Yeah, like little balloons they have all around their body, which makes their body quite light, but also gives them a chance to breathe oxygen incredibly well. But in her case, we've got a problem with one of those.
Yes.
And the bigger it gets, the more it's actually going to affect how well she eats, and it's going to start affecting how well she breathes, so to speak.
Yes.
So what we need to do, it sounds pretty dramatic, is actually make a little cut in the side and actually drain the air out, sure, but then look for where the leg's coming from. Because unless we can find that leg and fix that leg, this is just going to keep on filling up.
Yes.
She's going to need an anaesthetic for that.
Yes, we are.
And that's probably the thing that worries me the most. I'm confident we, yeah, when you watch how they talk about these birds and how they react when any bird is in danger, you start to appreciate how much they mean to them. That also means just how much pressure I'm under right now. Do you have a vet around here that I could speak to and possibly look at using the hospital?
Yes.
The fact that Johnny is so young means that it's going to be incredibly hard to judge just how deep she is under anaesthetic. Push her too deep, she may not wake up.
We are very worried. Yes, we just wanted to supervise the anesthetic. Yes, I know. You feel very uncomfortable and itchy. So itchy.
10-week-old Nala is suffering a severe allergic reaction.
So we're going to give her an injection of an antihistamine, so that will take away some of the itching and help with the allergic reaction that she's having. So do you want to just hold on to her and just a tiny little needle.
Worried. Teary.
With the injection over, Lisa is about to recommend something that Olivia doesn't want to hear.
I think it's a really good idea that you leave her in hospital so that if there's any problems with her breathing that we can...
9 p.m. tonight, my campaign team is bringing me an updated list of my supporters. I hope I'll see your name on the list. When we stand united as Americans, we're unstoppable. There's nothing like what we've done. There has never been a movement like this in the history of our country.
So, I'm setting up camp on a platform inside a cheetah enclosure to answer an ancient question. It's cold, it's raining, and it's wet. And I want to know what cheetahs prefer. Cold, wet, rainy, hard concrete, or a nice, warm, soft comforter, pillow, great company. It was late into the night before I was revealed the answer to the memorial question. A coalition of cheetahs was typically a leader, one that is bold, brave, and smart, an elder in many circumstances. The hierarchy occurs naturally in a coalition of wild male cheetahs. Female cheetahs are solitary and wild, but I've seen them create hierarchies in captivity. They display dominance, and there's a clear leader. As in this case, where the elder of these three shows initiative. In nature, you want your leaders to be smart and wise for survival's sake. One of these subordinates follows the lead of her leader. That looks good. Cuddling and snuggling is a survival trait for cheetahs and many animals that live together. It's because you conserve energy by sharing body warmth.
Cheetahs for sure.
Cannot die mid-early.
One thing about a hierarchy, if you're the last one on a totem pole, you get what's left over. This is Juno, and she discovered long ago the warmest, most comfy spot is right in between. And if a cat trusts and likes you, you can forget about your personal space being respected. It's a given they get to snuggle with you, especially at night. It seems real peaceful, and it is. You just don't get much sleep. When one wakes up, they all wake up. It's time to get up, readjust, and lay back down again. This goes on all night. So, yes, cheetahs are just like house cats. They prefer warm, soft, comforting blankets, cushiony pillows, and a warm body. They prefer that over hard, cold concrete. But the whole reason for that is natural. It's about the conservation of energy. Some of the food these cheetahs eat is used to maintain their body temperature. Maintaining it costs energy. It's a survival behavior that many animals exhibit in the wild. As for me, I'm the one benefiting most from the heat exchange. But the greatest reward is them trusting me and sharing the night together. If you like this video, please share it and give me a thumbs up. And consider joining my channel.
You say plain delay. Patrick and his biggest fan Mary here came on days like this. Called for Irish Spring Body Wash. Fresh, cool Irish scent.
Looks good today. Even better later.
Irish Spring. Clean up right.
No one owns the sunrise. It's a reminder each morning that nature.
You make my world a better place.
Yes.
Whenever I'm in Melbourne, I always take time out to see someone who I think is pretty special. Pam Ahern is essentially the patron saint of animals, and she always needs a vet.
Chris has arrived at Edgar's Mission, a sanctuary for homeless animals about an hour's drive from Melbourne.
Hey Pam, how are you?
Good, thanks, Chris. Thanks so much for coming.
That's all right. It's good to see you again.
Good to see you. Here you go.
Now, what's on today?
We've got quite a bit on today. Burpee the pig needs a bit of a tusk trim. Gretel, the little three-legged calf's grown and she needs her foot trim. So we've got quite a big day for you.
I didn't doubt it. Who's up first?
We'll do Burpee the pig, eh?
All right. For most people, just a couple of pets are a big ask and take up a lot of time, but Pam has over 300, all coming from really tough backgrounds. So for me to come along here and treat the odd pig, the odd lamb or cow, I get a bit of a buzz over it, but you know it's making such a difference to the animals here that really deserve that help.
Well, we've got Burpee over here.
That's Burpee?
That's Burpee. He's probably grown a little bit since you saw him last time.
Oh, wow.
Yeah.
This was how Burpee looked when he last met Chris. He was just 6 weeks old. Now the cute porker is all grown up.
Hello, Bert.
How's you been eating, Burpee?
Google Pig. Hello.
Yeah, you've changed just a little.
You can see these farm pigs, they get quite big.
And his tusks, first the problem here, it's starting to...
Yeah, they're starting to get quite big, yeah, and they're quite pointy.
He's now 220 kilos of grunting muscle and knows that he has big tusks to use on any vet that comes near him. They're fair weapons.
They are. I mean, you can see that they've really evolved to be great fighting tools. The angle that they grow out on, and this is how Jig put it, because he has a couple of friends in his paddock with him, he only has to just gently swing that head around and he can cut the other pigs. And even, for us when we go in to feed him, because they do like belly rubs and pats and things like that. So we've got to think of our safety as well.
Their tusks are big, they're starting to curl around, so he obviously needs it done. Whether he knows that, not so sure.
A huge Bernese mountain dog has been rushed into the Bondi Referral Hospital SASH. 2-year-old Chili suddenly collapsed with an extremely high temperature.
I'm suspected of a tick or a snake. Just a few hours ago, he was fine, and leaving him for a couple of hours, and he's gone downhill very quickly. Usually he comes running out of the gates to be fed, and he just sort of stumbled out and then laid on the floor and wouldn't move. Very alarmed.
What's going on?
This is Chili.
Yeah.
Chili hasn't been able to walk for about an hour and a half.
This dog is massive. He looks like a big bear on the table, and he just looks so sad. Hey, Chili. Pretty flat, aren't you? Let's just collect some blood so that we can check if it's a snake bite straight away, and we'll go from there. You're a good boy, hey? Chili's in a really bad way. He is so lethargic. He's weak. He doesn't want to wake up. His temperature is dangerously high. I mean, Michael thinks it could be a snake bite, but there's a whole lot of other things that could cause the same signs. I just hope the blood tests give us some more answers.
Yeah, I don't know if you heard, but we just had a big Spygate development as an IT report just dropped. After reviewing more than 1 million documents and interviewing...
Michael has only had Chili for 4 months.
It's just special. Part of my breeding program, but he's a really nice show dog as well.
The Bernese mountain dog was named in honour of the country he was bred in. It cost Michael $15,000 to bring the prize dog from South America to Australia.
He's lovely to have at home, so he does mean a lot. They all mean a lot, actually.
Good boy, Chili. It's okay. He's a very sick dog right now, so we've got to do a whole lot of diagnostic tests to try and work out what's happening.
That's a funny feeling that food might somehow be Burpee's friend.
Yeah, it certainly is. Yep, they're well-named pigs.
Burpee has dangerously overgrown tusks that need to be trimmed. To sedate the 220-kilo pig, Chris has a cunning plan.
With a big bowl of food in front of him, he'll be distracted enough, I'll be able to sneak up and put a little injection into his neck. You're hungry, aren't you? Yeah. It's no wonder you've got that amazing figure, Burpee.
Good boy. Hey, how good's this? Yeah, yummo.
I can feel something. There we go. So now it's just a matter of getting this injection in nice and slowly while he's eating. And then once he's asleep, we can get him there and do these tasks. It might be easy second back. Bed. 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 Come on. Thank you.
Back to bed? Good boy. Oh, he's getting groggy, isn't he? Good boy. Good piggy. Oh, he's a good pig. He's a good pig. Oh, what a good pig. Oops. Missed the starting line.
Good go. That's it, buddy. He's time to sleep. Let's go.
Good boy.
actually, but so the plan is to get in there with the wire, being very careful that he is going to stay asleep, and then start to shave those tusks away. It's incredibly dangerous, so we just have to make sure he is really and truly asleep.
Bit of a dramatic morning. I've just had a call from one of the keepers, and Cameron, our cormorant, got himself in a bit of strife. Looks like we might have to catch him, but never a dull day at the reptile park.
The tiny bird appears to have something stuck in his throat.
He's uncomfortable, and we can see a big lump in his neck. The longer it stays in there, the more dangerous it is, and quite genuinely he could die. There goes Cameron, straight down. As soon as they see the nets.
But Tim knows catching the elusive Cameron is going to be a challenge.
No sign of Cameron.
Especially as he shares the pond with his lookalike brother Craig.
Where's your brother? It's time for hauling in the reinforcements, and it looks like we're all going to get wet. Trev, can you come down to the turtle pond? Your mate Cameron's give me the slip. Can't see him anywhere, so I need help, mate. And can you grab Jules too, please?
Yeah, mate,
There's probably going to have to be one person that's spotting Cameron because they're little buggers. They go underwater in one spot, then they pop up 10 metres somewhere else. So we'll have a spotter, and two of us will get in the water, and we'll actually work together and try and corral him to one end of the pond to make it a bit easier to get him. That one? No. Thought the crocodile was real. I'm about to go swimming with him. Look out, Trev. Don't worry about the sticks and mud. So, Jules, he's got a silver band.
All right.
Okay, and his brother Craig's got a yellow band.
There's one up this end.
Yeah?
Yeah.
Just one?
Yeah. Just I've only seen the one.
That's him. Missed him. Oh, it's slippery, mate. There's about this much sludge, and it stinks. Look, bubble.
He's onto us.
You know they've gone by because there's this little mud plume where the bird's been. It's not an easy task to catch a cormorant. Yeah, there he goes.
What? Good boy, Chili.
2-year-old Chili has been rushed to Sash after suddenly collapsing at home. Owner Michael is worried his prized Bernese mountain dog has been bitten by a snake.
So we've done a couple of blood tests on Chili, one to check the level of his muscle enzyme and the other one to check his blood clotting times, and both of them are normal. So the next step is to do a venom detection test to see if there's any sign of the venom circulating through his body. So negative.
Negative, yeah.
Yeah. All right. Well, at least we've ruled that out. Good boy. Yes, yeah. Chili's got a really high fever. It could be anything. It could be an infection. It could be inflammation. It could be cancer. Good boy.
Lisa's hoping x-rays of the chest and abdomen will provide clues to what's causing Chili's dangerously high temperature.
Good boy, Chili. It's okay. They all look pretty normal, so the problem is we still don't know what's causing Chili's signs. We've got the really sick dog and no answers yet. So we're going to do an ultrasound of Chili's abdomen next, and I really, really, really hope that we're not finding cancer in there.
Before the ultrasound, Lisa needs to break the news to Michael.
Being a Bernese mountain dog, they are prone to certain cancers at a young age, as you know, so we cannot ignore that. I can't make any guarantees. Okay.
Just one back for him better, and quite possibly it could be something big. So, yeah, a lot to think about. Hey, what are you doing? You out today? I'm sleeping off.
At Edgar's mission, Berkey is now asleep, and Chris is happy to start removing his dangerous tasks.
This little cup here, geez, that's sharp. It's only now when Berkey's asleep and I can actually feel those tusks with my own fingers that I realise just how sharp they are. They obviously need to come off. Getting them off, though, might be tricky. The key here is just getting the wiring around this task. And give me an initial cut because this doesn't really work that well otherwise. Definitely feels sounds bad with the dentist.
Oh, wow. Good job.
I've got a feeling the one on the other side is even bigger. That means rolling over a 220 kilogram pig. This is not going to be simple.
Good kid. Good boy, Berkey. Good boy. Way to go, Berk.
It's about 2 inches long, so almost 6 centimetres with a really sharp point in it.
Oh, there you go. Oh,
That's a good one. Now that Berkey's done, Pam and all the volunteers here are going to be a lot safer. There's no doubt about that.
Before Chris leaves Berkey to sleep off the sedation, he's got one final gift.
Obviously, Berkey believes in the tooth fairy.
Absolutely.
Stephanie Brooks. Exactly.
I feel so
What?
sorry for Chili. He's just a big, gentle giant, and he's feeling really, really sick. I want to be able to help him, so I'm just going to have to run test after test to try and find an answer.
At Sash, 2-year-old Chili's ultrasound is underway.
Chili's a good boy.
The massive Bernese mountain dog collapsed suddenly and has a dangerously high fever.
These are the lymph nodes that are enlarged.
So he's got like a focal area of inflammation in his bowel.
Yeah, he does.
What?
You need to trim your nails.
I know. Dude.
We're looking at all the organs, and then we get to a loop of bowel that looks really abnormal. In need to really monitor this area very closely because if it gets any worse, we have to send Chili straight to surgery.
Chili will have repeat scans in a few hours. If he doesn't show any improvement, exploratory surgery will be the next step.
I'm in my hometown, Newcastle, catch up with the flights, but to also call on a family who have asked for a bit of help before they bring a new pet to the house. Now, this new pet, it's not a dog, it's not a cat, it's not a bird, or even a guinea pig. It's a pig. Now, pigs are all the rage at the moment, but they can do a lot more work than people think. So I want to call in and see these guys and see if they really know what they're getting themselves into.
The Black household is already home to Michelle and Kieran, their two daughters Eve and Heidi, two chicks, and Ned the dog.
You excited about the pig? Yeah. Have you guys chosen a name yet? Petal.
Petal.
My one fear with pigs whenever I hear that someone's getting one is that, just do you really know what's involved? Because pigs, they're not simple creatures. They're complicated. They're so incredibly intelligent, so good to be active. Sometimes they're very demanding.
You do get these proposals from time to time, and right now, it's pigs. I get asked all the time, what's a pig like? Should I get a pig? Will a pig suit me? And the reality is, a pig only suits certain types of people. Because
who's driving the whole pig thing? Is it the girls? Is it you that wants the pig? Or is it, how does that all work?
It's you. My birthday present. We actually talked about having another child and then decided we'd get a pig. If you've got two kids, how hard can a pig be?
Chris has brought an iPad full of mini pig info to educate the family before they commit to a new edition.
There's no such thing as a mini pig in Australia. We don't have teacup pig. We don't have pot-bellied pigs here. We've only got pigs. Why do we get the small ones? Is just by breeding the smaller versions of the standard pig. If you are feeding them pig food or a whole lot of basically whatever they want to have that's high in protein or high in fat, then they are going to grow to be quite large. I've seen mini pigs that have been 150 kilos. I don't want to see you guys all of a sudden get stuck in a situation where you have this monster pig when you thought it was going to be tiny. Where do you think this pig is going to live?
I think it can come inside, but I think it will sleep outside.
Do you have a doggy door? Is the pig going to use that as well?
Until it can't fit.
So,
Yeah.
Knowing how pigs think, there's going to be a day when all of a sudden he can't fit through anymore. But that's not going to matter. He may just make the door bigger himself. And the reason why I'm here is because I've seen pigs that are just incredibly destructive, that try to overrun people's lives, try to dominate every part of their life.
Really?
Yeah. Pigs are incredibly headstrong, and once they have their mind focused on doing something, they'll make sure they do it. I'm guessing that's the pantry there, right? So, my rule is if you can get your foot in there and start playing the doors like this, then they can go.
I wasn't aware of the pantry. I sort of tearing the kitchen apart to find a snack probably is a bit of an eye-opener.
If they can't get into it, that's where they get frustrated and they'll start to really bash into things or chew on the little handles or the phrase pig-headed. That exists for a reason. Your living space really becomes theirs.
That's not something I've thought about.
We adopted Maya first, and then we added Rocky to the family, and she quickly
hospital Sash, suffering from a mystery condition.
She's got a discharge from her nose all the time. She licks her nose all the time and it doesn't look right. One day it started doing this horrible coughing and sneezing, like, it sounded like she was drowning in an asthma attack all at once. And it was just like, came out of the blue. And I was like, oh my goodness, what's going on here? Did I have a look at my phone? I've got some few photos on my phone.
Co-owners Fiona and Kevin have plenty of great photos of their national flyball star.
Cleo lives for flyball. It's her whole world. She's obsessed with it. For her not to do flyball will be really hard for her, really hard.
How long has it been going on for?
She's only been really bad last week.
It's definitely getting worse.
Yeah, exactly.
Emergency vet Lisa Thomas is now waiting for the results of blood tests taken earlier in the week.
So what I'm doing now is I'll just check if she's got air flowing through that nostril. So it's a pretty simple test. And that's good. She's got airflow going through both nostrils, so that's one good sign. It could be something as simple as a foreign body, like a grass seed that's in there. We can pull it out, problem solved. But then there's more complicated things like fungal diseases and tumours and things like that. Let's wait for those blood results. Once we get them, that will chap us in the right direction where we need to go next.
Cleo is everything to us. She's a very, very special little girl. It's just, it's horrible. It's really, really horrible.
Shorts on.
The Border Collie's test results have just come in.
Oh, I was really hoping that it wasn't going to be this. Okay. Unfortunately, it shows a very high level of infection called cryptococcus, which is a fungal infection, a very rare fungal infection.
Cryptococcus is such a rare disease that on average Sash only sees 2 cases a year.
It's found in pigeon droppings, it's found in hollow trees. A lot of the time we don't actually know where it is. It's an infection that any dog can get. We'll never be able to say that you can prevent an animal from getting it. It's just one of those things that is found. The next step would be to do a CT scan. Okay, so what we'll do with that is we can look at her brain, and we can look at how aggressive this infection is. In some rare cases, it can spread to the spinal cord, and it can spread really all over the body. Well, it depends on where it is. Okay, generally, if it's in the nose alone, the chances of recovery are a lot better than if it's been spread to the rest of the body, particularly the brain. You get that scan done? Yes, you will.
Cleo will now be given a CT scan to find out if the infection has spread.
Everything will be alright.
Why, Cleo? Why?
There. That's right. It couldn't happen to anyone, I suppose.
Fiona and Kevin just cannot believe how unlucky they are, and we have no answers. It's just lottery, and it's bad luck. All right, we'll give you a little injection now, and you go to sleep. Yeah. There you go, Cleo. There you go. All right.
I'll show Dr. Chris where the house is.
Chris is in Newcastle inspecting Michelle's house to make sure she's ready for the challenges of owning a mini pig.
What is this?
That's Duckchuck.
Dumb chook.
Yeah, and the other one over there is Smart Chook.
The mini pig will have to fit in with Michelle's chooks, two rowdy kids, Harley and Eve, and their dog Ned.
Ned's looking a little bit put out already. This is pretty good.
Mummy made it.
Because normally,
Mummy
within a week of having a pig, that's how your lawn looks. So let's just check this out. What do you think Petal's going to like about being in there?
Because it's nice and cozy.
Cozy? That's the other thing, they're incredibly sensitive to cold. When you're hearing about the digging, the pig-headedness, are you being put off yet at all?
No. I think it'll be good. I think it'll be fun. I mean, the chooks are messy and noisy, and I love it. I love the yard.
Honey, stop!
Trust me, chickens digging in the yard is like someone digging with a toothpick compared to what a pig is going to do. You know what, I actually do worry that I'm sounding a bit negative, but I've seen so many people burn before. People with pigs that just can't control.
Would you like to come with us to get our pig?
You inviting me to help choose the pig? Yeah? Is this an official invitation?
Yes, most definitely.
I would love to. I want to see this.
This year, that slippery safety thing you slept. I'm finally catching sandballs tonight.
Save up to $150 on an unlocked Google Pixel 4 and get a Nest Hub on us.
So we've got the images loaded, so the CT scan images. So I'm walking Kevin and Fiona through to show them the scans. It's just something that's really difficult. Here we've got them that the fungus has made all the way up her nose to her sinus and now has entered her brain as well. That she will die from this. And, the best thing we can do is start treatment straight away.
Lots of flowers at Clear Infinity. Since you guys loved the previous item battle, we're doing a part 2. We have 21 items and we'll be playing 1 point with each of them. And since Christmas is right around the corner, that will be the theme for today. Okay, good luck, Emma. Good luck. First item, normal random. Oh, good. Okay, next one, the chocolate bar. Milk chocolate with salty toffee crunch. Oh! Yes, always trust the toffee. Okay. The sledge. Oh, wait. Yeah, no. This is the one. I think that's the wrong time. No, this is good. That's how it goes when you try to cheat. Okay, sledge against sledge. This is just the beginning. Okay, next up the glove. I think I know how to play with this one. Is this serve allowed? Oh, come on! Okay, this one won't be as easy. Yes, I got it back. I think the ski should be quite easy. No! Oh, that was so close. It's actually okay feeling on the ski. Yeah, it's surprisingly good. Yeah, it's a Christmas card. I've developed the best serve for a downhill ski. Ooh, The syrup was good, but I wasn't ready for the next one. I was surprised by the syrup. It was actually good. Christmas card. Oh no, oh no. Counter-attack. Good card. Okay, helmet against helmet. Maybe I'll try Anil's tactic.
I swear if you took my arena points, I'd dead.
Christmas present. I wonder what's in here. Okay, so I get to open my present first. It's really exciting. Oh! I think I know what this is. Oh, yes, a Pongfinity hoodie. I wish I get Pongfinity hoodie. I wonder what's inside me as of now. The question is, how should I play with this? Oh, no. There isn't like an even surface here, so it's a bit difficult. Yeah, it's so random. Now I get to open my present. I have a small feeling that it's a Pongfinity hoodie. I'm not sure. Oh, there it is. Pongfinity hoodie. Whoa! It's not ice scraper and brush. Oh, what a save! Yes!
Oh, dude.
Yes! Okay, brush against brush. Yes. No. This one's a Christmas. A wooden. Christmas sock. It's gonna be hard. Okay, so this is apparently my Christmas decoration. Christmas tree. You know what they say, when it comes to trees and socks, socks always win. I'm not finished saying. Yes. Oh, yes. Good smash. Yeah, no, I think the ball's over there. Really? Yes. Yeah, a very fruity wine. Quite bouncy. I love the spin. I guess I won. Kristen's light. Oh, so that was pretty cool. Oh! I'm a bit tempted to eat this one. I look so scared. Did something come? Yes. Okay, this is a bit dangerous. I'll ditch the whipping strategy. Next time. Yeah. Oh no! But I won the point. It was my plan all along. That was a good strategy. Yeah, I have to finish my previous racket. Just a minute.
You're having that strategy. Okay.
Time for the tiny Christmas lady. Yes. So it seems that my Christmas decoration is a snowman and Christmas lady. Yes. Okay, the Christmas decoration or the Christmas girl. Coming distractions. Candle.
Take it.
I guess that means I won the point. Okay, so unexpected ending. Well, that was a good idea with the spinning set. It was such a nice idea. Right, good match.
If you enjoyed this game, make sure to subscribe here and watch the previous episodes.
Merry Christmas. Yes, guys, it's Samuel Williams from Shakespeare Trade. Today we're going to take on the public here in London. We've got 1,000 pounds. Now, on nervous. It's only 5 points. First to 5 points, so there's a lot at stake here. Is someone get the 5 points for us or win the 1,000? Let's go. Bring it on. Who's our first challenger, guys? Okay, so first to 5. Okay, ready? 0-0. Whoa. Whoa. Oh, nice. 1-1. Thanks so much, thank you. It's a bit windy, intense. I'm a bit worried about the wind, but we're going to have to go with the flow. So happens. So far, we're 1-1. Delivery man, love it. 1-1. I'm feeling this. Okay. Oh, 2-0 to us. Doing really well. We can't play properly. Oh. Oh, you're not Christmas. See if that's like oh. Hey, yo, you had my heart racing. Good game, bro. Nice. Oh, I want to see that go up. It's very everything. Oh, definitely played for fun. We got an injury. He's here in the pitch. Thank you very much. Appreciate it. I think we'll take 1 point here.
It's a Gus first place, man.
不是，冲突一方就一直跟我讲说，他还蛮期待看这场比赛，看看赛夫在比赛过程中会不会有什么样让大家跌破眼镜的做法。
惊人之举，
惊人之举。
真的很期待。
庄之渊目前在小组赛当中呢，对于刚刚这个接发球的处理，他自己也很不满意啊，
是，
这大声的咒骂了自己一声。
但是欧洲选手他们本来接发球，他们小球就比较差，他们抢是抢在他们像这种球，我们现在看到的大球很强，真的很强。啊，他们要转圈了吗？啊，他们要转圈了啊！
差一点点，几乎都已经布局成功了。
对。
刚刚这个球如果再进的话，真的就要转圈了哦。
对。
开个小门，你说开个小门，等下方便我一点。
我不要用跳的。
对，我等下绕过去就好了。我现在相信了。我现在相信赛夫会把高雄小巨蛋搞成他的主场。
对。
这个副审
不领情。
赛夫说：“麻烦你坐回去好不好？”他要就把门打开。没有这个动作说。先让我适应一下，待会如果有需要的话，我知道
试跳。
还有。
对，
发球处了。小球。小球，3度掉这个庄之渊到往前的，
是，
所以他也很希望大家对他留下深刻的印象。
没错。
小球。 忘记。哦。张军拿下了局点在。
削球。削球。你怎么不发力？对啊，怎么打得这么软？你打强一点呗。张真源说：“我的错，我的错，
没有符合你的要求。”不容易耶，真的要取悦观众哦，还要能够打球，真的不容易。但是今天好像就比较没有那么像赛夫那么熟练了。
对。Power， 对
，more power。打到这边来，打这边转向吗？
他说换一位，换一位，换一个。
不要动他，不要动他。
Finally, my lag is calming itself.
副神也不管了。
对，副神是因为赛夫呢，对大家也知道。
对，
是啊。还有左手。还有啊，没有转回来，4-1。同时卖观音的。有这一招。
Hey, one more, please, game. Let's get it. I'm not even gonna get the flops. Gotta get them juice boats.
Power. 哇，真的是很有趣的一局啊！什么时候可以看到在桌球的比赛？
结果他的分数已经被赛夫悄悄的翻了好几分了。对，
打的时候就是一边抽一边翻台嘛。
对。其实副神他自己都不知道被翻了。
对，因为他刚刚是为了躲球，
对，
视线根本不知道。 突然之间好像分数不重要，大家一阵雾水。
是啊，
几乎是零小度的。
Pump right now.
Oh. 马上下一个球。Post 张轩说没有同意你暂停。
不是，跳六。哦。
再跑下去救那个谁。哇，原来你桌球可以这样打，哇，太有趣了。这真的就是赛夫，
他一定也就成功了。
真的，快点10比10。叫做干扰对手击球，
是。
赞助商会很开心，因为这个是我的焦点会在那个看板上面。
转过来了，转过来了。
终于是产生结果了，就在最后一场的小组赛，也是赛事在高雄小巨蛋的最后一场的比赛，做大的娱乐性是。
Hi, I'm Raleigh Williams, and I am your average pool player. But this is Florian Kohler, and he is your well above average trick shot shooter. Today I'm going to coach Florian 5 effing raised trick shots, and I'm sure going to make them. Love your confidence, Florian. Normally we just do one, but because I've got an expert here, he's going to coach me through all the steps of the process, and I'm going to get it done in lightning speed. So let's get started.
This first Efren trick shot is pretty radical. Here he has the cue balls in the jaws of the pocket, and he's fenced in on all sides by other balls. So he drills into the corner of the pocket, which pops the cue ball up and over the other balls, around 3 rails to hit the 1 into the 9 into the pocket. It's a really flashy shot, and the crowd understandably goes nuts, so let's give it a go. My first try is bad. It doesn't catch any air, just plows through the other balls, but somehow it finds its path to the 1 ball. It obviously doesn't count, but it's better than if I hadn't made it. Florian steps in to try it out to make sure he knows what the trick is, and makes it on the first try. Again, this is the dude you want to have around.
What, Mom?
I was thinking about tamales for dinner.
Okay. Okay, Mom?
Would you like salad or cucumber with it?
Sure.
Which one?
I don't really care.
Around when you're trying to recreate trick shots. Here is his diagnosis of the shot.
Aim to have the corner edge of the cue ball. So basically only a corner of the edge of the cue ball is points, and 3/4 of the ball outside. Okay, top, left, and the huge stroke is like forward. More.
Right away, huge improvement. You can tell because I didn't hit the cue ball straight into all of the balls. By using top left and hitting it hard at a downward angle, I'm giving the cue ball a little bit of a bounce, kind of like a micro jump. The point of the pocket that magnifies the jump like a trampoline because the cue ball is hitting above the rail at an angle instead of straight on. I went around the 3 rails like I wanted to, but then I hit too high up on the long range. Ordinarily, I would have experimented with hitting it harder or softer, but Florian, how do I put this? He's a lot smarter than me, so he had some better advice.
You could aim fuller a bit. So fuller in the corner, fuller in the corner, just a tad. I'm not sure.
Hitting the point a little fuller will shorten the angle and send the cue ball closer to the far corner pocket before coming around the 3 rails. So I make the adjustment and that was easier than it usually is.
There you go.
Okay, 1 shot down. This next Efren shot is this nice little draw where he hits the 1 ball almost completely straight to the upper left-hand corner, travels forward just a little bit, and then draws straight back to sink the 9 ball in the lower left corner in the same shot. It's cool to see the cue ball completely over the interfering ball, and I don't totally understand how it doesn't clock the 8 on the way up, sink the 9 ball in the lower
One shot down. This next Efren shot is this nice little draw where he hits the one ball almost completely straight to the upper left-hand corner, travels forward just a little bit, and then draws straight back to sink the 9 ball in the lower left corner in the same shot. It's cool to see the cue ball completely orbit the interfering ball, and I don't totally understand how it doesn't block the 8 on the way by, but let's give it a shot. My first attempt, I try a fairly level cue, a good amount of draw, and nope. Florian jumps in to get a feel for the shot, and he overdraws it, which I didn't even think was possible. He tries it again, nails it. His advice this time was much simpler. Forget the 9, just aim completely full, and focus on really getting through the cue ball as low, and smooth a stroke as possible. And kiss my grits, it worked.
I'll take a lucky day, baby.
Shot number 3 is a sort of masse kick shot, where Efren hits the cue ball into the left rail, but it's got so much masse spin that it bounces off, and then the spin pulls it back toward the rail, making the ball spin. Now, this shot probably would have been a lot harder for me if Florian had just taught me how to properly masse a ball a day before. Watch that video if you want to see that happen. Link it, whatever. This shot was a little different for me because I'd never massed a ball into a rail, but the principle seemed pretty simple. Attempt number 1 hits the right look, but I hit it way too far toward the top of the cue ball, which resulted in not enough spin. But Florian had a little confidence in me, and instead of jumping in, he just had me reshoot the shot with more left. So for shot number 2, I was home free. No. Okay, so we had the same problem the day before, and I learned this very valuable lesson.
I see you're going a lot on backspin. You want to be right here. You don't need any backspin, really. It's just a side spin shot.
Now, this is interesting because every masse that I hit, I always think, oh, hit it with backspin. I don't know why. I don't have to hit this with any backspin.
No, really, because the side spin will be enough because you're not trying to really make the cue ball come back to you. You're just trying to make it turn, right?
Yeah. Masse shots don't need backspin. Even though something in my brain says I need to hit the bottom of the ball, I can actually just hit the far left side. So on shot number 3, I just hit it on the far left side of the ball with no backspin, and... yeah! Is that right? Alright, let's move on. Now, I am something of a completist, so I did make Florian jump in there and do the shot himself. But what are the chances that he's going to do it way, way better than me? Okay, that was pretty good, I guess. Alright, well, 3 down, 2 to go. Shot number 4 is a genuine old-school Efren trick shot, and it's from this TV show where apparently Efren just goes buck wild and a studio audience freaks out. And I would watch that show every day. Here it is. Okay, let's see that again. The 1 ball and the 2 ball are frozen to each other in the middle of the table. The 4 ball is hanging over the side pocket, and the 3 ball is frozen next to it. Efren hits the 1 ball, which sends the 2 into the side, and the rebounding cue ball hits the 3 ball. The 3 ball hits the 4 into the side, and then goes down into the corner pocket, where it is joined by a slowly drifting 1 ball. Then Efren drops one of the most impressive victory dances of all time. Now, obviously, the dance part is way above my skill level, but the shot part seems more doable. Let's go. Right off the bat, I assumed this shot would be on the easier side, since I just have to line the balls up with the pockets. This turned out to not be the case at all. Okay, we spend a little bit more time before it jumps into